Thank you. I think we should start. May I request everybody to mute their microphone? Although as host, I have authority to unmute everybody, I don't want to do that. First of all, I would like to welcome our guest, Dr. Rajesh Panda, WHO representative, and soon General Balananda Sharma, head of the committee of CCMC, is going to join and give its remarks as well. And welcome to all the members, FIPMO members, and other guests. We are most fortunate that Dr. Panda is here to give us some perspective from WHO. Then likewise, we are also fortunate that General Sharma is going to be here. He was going to be traveling, so in the beginning we are not quite sure, but now he said that after that meeting he will come and join. So I will be very brief. After I will say a few words to introduce FIPMO, then I'm going to request Himalaya Rana, patron of FIPMO, to say a few words of welcome. Then we will listen to Dr. Panda, WHO representative. Following that, 5 of our FIPMO members will share their thoughts. And while they are speaking, I will try to monitor the chat, and if there are any questions, I might bring that up. Otherwise, we will have discussion after the completion of all the presentations. So very briefly, the FIPMO, as the name suggests, is former international professionals of multilateral organization. The organization was created in January 2015, about 6 years ago, with the main purpose of bringing all the former international professionals together, professionals who had served in the United Nations, international financial institutions, and regional institutions, to bring together in order to collectively contribute. Mind you, collectively, because individually, everybody, almost everybody is engaged in some way in making contribution in Nepal. But we wanted to bring all those expertise together and contribute for the country, for Nepal and its people. Right now, we are about 80. May I request once again to mute the microphone so that the disturbance, the dog barking from the garden does not come into the meeting. Sorry, so there are about 80 such professionals in our roster right now. Not that everybody is included because we are still collecting that information. And 48 are subscribed members. About 50% are active, always participating in one activity or other. We have offered our pro bono services to the government in Nepal, and we are also engaged in enabling vulnerable population in their economic activity and society. The event today is to share the expertise of FIPMO members in this time of national crisis. COVID-19 pandemic has affected many facets of the society, and 5 of our FIPMO members are going to share their thoughts in this their respective areas of expertise. I will introduce the speaker later on, but the topic is going to be public health, agriculture, economy and livelihood, education, gender equality and social inclusion, and finally, operations and logistics. Our hope is that the third that FIPMO members are sharing based on their expertise and experience serving in international organizations in multiple countries will be of value to the government and other civil society actors in this time of pandemic. With that, may I ask Patron Himalaya Rana to say a few words.
सुरेशजी, मलाई पहिले बोल्न मौका दिनुभएकोमा धन्यवाद तपाईँलाई अर्पण गर्न चाहन्छु। अब यो कोभिड-19 र यसका भेरिएन्टहरूले म्यानकाइन्डलाई नै धेरै दुःख दिइरहेछ। नेपाल पनि धेरै दुःखी छ। मलाई एउटा के लागिरहेको छ भनेदेखि अब हाम्रो देशमा चाहिँ नि कोभिडले चाहिँ नि पूर्व पश्चिम काठमाडौँ सबै ठाउँको मानिसहरूलाई एफेक्ट गरिराखेको छ। तर हामीसँग एउटा त्यस्तो सफ्टवेयर छैन कि जस्तो लाग्यो, जसबाट कि एउटै फर्मेटमा चाहिँ नि देशभरिमा कहीँ के कोभिडको कुनै इन्फेक्सन हुने बित्तिकै त्यसको चाहिँ इन्फर्मेसन आइहाल्ने। त्यो आएको भएदेखि चाहिँ नि हामीहरूले टेलर मेड चाहिँ नि रेस्पोन्स गर्न पाउँथ्यौँ। किनभने अब यो कोभिडलाई चाहिँ नि सामना गर्नलाई प्रयोग गरिने अस्त्रहरू त हामी सबैलाई थाहा छँदैछ। भ्याक्सिनेसन चाहियो, हस्पिटलहरूमा चाहिँ नि उनीहरूको ट्रिटमेन्टको फेसिलिटी इम्प्रुभ गर्नु पर्यो, सोसियल डिस्टेन्सिङ गर्नु पर्यो। यी कुराहरू त सबै थाहा भएकै कुरा हो। तर मलाई के लाग्छ भने अब हामी यहाँ काठमाडौँमै छौँ। मेरो ज्वाइँ चाहिँ धनकुटामा जानुभएको छ। उहाँबाट मैले खबर पाउँदाखेरिमा धनकुटा बजारमा चाहिँ नि अनएक्सपेक्टेडली छैन रे, कोभिडको त्यति विधि सङ्क्रमण चाप छैन। त्यस्तै मेरो गर्ने एकजना मान्छे जनकपुरबाट गएर आएको थियो। उसले पनि जनकपुरमा पनि बजारमा छैन भन्छ। त्यस कारणले एउटा वास्तविक चाहिँ नि हाम्रो कहाँ सारी चाहिँ नि एफेक्ट भएको छ भन्ने कुराको एउटा थाहा हुने।
म्युट भएछ हिमालय शमशेरजी, म्युट भएछ।
हजुरको स्वर सुन्नेन हिमालय ज्यू। म्युट थिच्यो जस्तो।
बसिरहेका छौँ हामीले। काठमाडौँमा के भइरहेछ भन्ने त अलरेडी थाहा छ हामीलाई। तर धनकुटामा के भइरहेछ, जनकपुरमा के भइरहेको छ, नेपालगञ्जमा के भइरहेको छ भन्ने एक्ज्याक्ट इन्फर्मेसनहरू चाहिँ नि त्यसको आउला जस्तो लागेन। किनभने त्यो आएको भएदेखि चाहिँ नि त्यो ठाउँमा के भएको छ त्यो अनुसारको टेलर मेड एउटा रेस्पोन्स गर्न सकिन्थ्यो। त्यस कारण एउटा सफ्टवेयर डेभलप गर्न सक्यो भनेदेखि देशभरिमै चाहिँ तुरुन्तै केही घटना हुने बित्तिकै त्यो सफ्टवेयरमा आइहाल्ने, सबैलाई थाहा हुने, अनि त्यो टेलर मेड रेस्पोन्स गर्न सक्यौँ हामीले। अब अर्को कुरा, अब म त अलिकति अर्थतन्त्रको बारेमा चाहिँ अलिकति त्यसमा चाहिँ संलग्न भएको हुनाले यो कोभिडले चाहिँ त यो हाम्रो टुरिज्मलाई त साह्रै नै एफेक्ट गरिरहेको छ। स्कुल्सहरूलाई, एजुकेसन इन्स्टिट्युसनमा साह्रै गरिरहेको छ। त्यस कारण एउटा ट्रेड अफ गर्नुपर्ने बेला आएको छ। किनभनेदेखि अब कतिसम्म हामीले लकडाउन गरिराख्ने, लकडाउन नगरिकन बरु एउटा स्ट्रिक्टली चाहिँ नि 25जनाभन्दा बढ्दा चाहिँ मानिसहरू बिहा व्रतबन्ध जात्रा सात्रा कुरैमा पनि गर्न नपाउने त्यस्तो किसिमको एउटा स्टेप लिएर अरू कुरामा चाहिँ अब नर्मल अरू चाहिँ काम कारबाहीहरू सबैको चालु गर्नु पर्यो कि क्या हो। नत्र भने त यो कस्तो होला भनेदेखि रोग चाहिँ निको भयो तर बिरामी चाहिँ मृत्यु भयो भने जस्तै हामीले चाहिँ यसको ट्रिटमेन्ट कायदा साथसाथ गर्ने, सामना गर्ने, तर त्यसबाट अर्थतन्त्र चाहिँ एकदमै एफेक्टेड भएर गएर साह्रै हाम्रो अर्थतन्त्र जोगाउन गाह्रो पर्यो भने पनि त्यो राम्रो कुरा भएन। त्यस कारण मेरो मुख्य कुरा भनौँ यही नै छ। धेरै वक्ताहरू छन्, सबैजनाहरूबाट बहुमूल्य सजेसनहरू आइहाल्नेछ, त्यो सुन्नलाई म आतुर छु। धन्यवाद।
धन्यवाद हजुर, थ्याङ्क यू भेरी मच। Without any further delay, I would like to invite Dr. Rajesh Panda, WHO representative in Nepal, to make his remark. Dr. Panda.
Thank you very much, Dr. Sharma. Good afternoon, good morning, good evening. Namaskar from Nepal. Thank you, Doctor. Thank you to FIPMO to invite me for your meeting, regular meeting which you have. I think Dr. Balananda Sharma has not joined yet. So I will start. So all the distinguished speakers and who are going to speak at this and members of FIPMO, thank you for bringing together minds to channel our collective efforts to making health for all a reality in Nepal, despite the onslaught of COVID-19. I must confess that I feel somewhat uncomfortable with the word former in your organization's name. Now, once an international officer, can you ever be a former? I don't think so. Being an international officer of a multilateral organization is not merely a career, but a way of thinking, a way of life. The fact that given the vast range of options you have on how to utilize your precious time, you choose to organize this meeting of minds shows that you are not former, you are present, and you are very relevant. The 1948 Constitution of the World Health Organization defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is now a universally accepted definition of health. At the root of health, all health issues, is the issue of equity. That we live in an unequal world has again been exposed by the COVID-19 pandemic. The most significant impact of COVID-19 is that it has worsened inequality and poverty. It has disproportionately impacted those already vulnerable, such as the poor, lower paid members of the workforce, elderly, persons with disabilities, migrant laborers, refugees, and homeless. COVID-19 has laid bare the inequities that influence health and has underlined the urgency of addressing health inequities. I hold equity very close to my heart. I have grown to appreciate from my childhood days the importance of equity in life. Had it not been for individuals who passionately believed and practiced equity, most probably I would not be in Nepal today. I would not have had the privilege of working for WHO nor access to the medical education. My family comes from a small village in Maharashtra in India with minimal means and little formal education. Had it not been for a school teacher who spotted an unusual spark for learning in my older brother and arranged for a scholarship for his further studies, education may not have reached my siblings and I. Access to education led to equity in many other areas of life for me and my family. So I'm here today at this distinguished forum because of individuals who tried in their personal capacity to correct the inequity. Today, the members of FIPMO are striving to contribute to their capacity as individual practitioners of equity and solidarity through this meeting. My personal experience has shown me the challenges of inequity even in a family where some equity was achieved. So while my elder brothers and I managed to study medicine and become doctors, my elder sisters were left behind and were married off at an early age instead of being given the choice of education. Hence, it is of paramount importance for us at the individual level to be conscious and alert about the possibility of inequity in our immediate surroundings and proactively do our bit to address this. It is unacceptable that in the 21st century, we continue to see significant injustice based on gender. Dear colleagues and friends, COVID-19 started as a public health emergency, but it is now a societal crisis. It has illustrated how health has social ramification and social welfare has consequences for public health. It has again highlighted that the importance of social approach to health that mandates the intersectoral, multisectoral action to improve health by addressing social, economic, environment, and political factors that shape health. Health equity can only be attained by addressing the structural roots of inequity. Therefore, health policies must be implemented in conjunction with policies that directly address health's social determinants, including an inequitable distribution of sources. Herein lies the importance of those present in this meeting. Number one, you have a wealth of expertise and experience in different sectors: food, agriculture, trade, protection, refugees, migrant labor, you name it, and the sector is represented in this meeting. Two, you have precious experience in facilitation, negotiation, and cross-collaboration. International work in a multilateral organization rests on our ability to reach out and create coalitions. The MDGs and SDGs came about through complex negotiations and facilitation by the international professionals of UN agencies. Dealing effectively with COVID-19 and healing our society from its aftermath requires intersectoral collaboration, especially in Nepal. Third, you have the talent to harness the power of your vast networks. The wealth of meaningful contacts that exist within this meeting today can be weighed in gold. To build back better from COVID-19, Nepal needs to muster all these networks nationally and internationally and channel them towards intersectoral collaboration. WHO has been supporting the government of Nepal for 60 years with technical expertise and resources. However, the world and WHO have moved thinking in terms of disease to thinking of health. As a result of our direct audience has also shifted from exclusive lounge of health experts to the country's entire population. Our messages can be effective if our credibility is high. And for that, we need to be able to unpack the meaning of multilateral organizations. Unfortunately, I see that we are confused for an NGO or a grant-making body, even among senior decision makers. This is where I seek your support. Please help us communicate to policymakers and policy shapers in Nepal what multilateral agencies are, how they are governed, and what value they bring to member states. What better forum for this than your organization? Secondly, I urge you to convey in your circles of influence that while COVID-19 has a health aspect, has equally critical societal dimensions. Until the line ministries of Nepal don't get deeply engaged in joint solution searching and effective implementation of public health and safety measures with the Ministry of Health, we won't beat the virus. Third, please follow public health and social measures so that you and your close ones remain healthy. Only when healthy can you undertake all the noble work that you wish to advance. I invite you to visit WHO's Nepal website, Facebook, YouTube, and Twitter, and some of you follow that. Here you will find resources that will help you stay safe. You can also learn about how WHO has supported Nepal with technical know-how, human resources, in-kind supplies, and much more. Our weekly situation reports are available here and on Relief Web, with which, of course, you are all familiar. Dear friends, I am in Nepal by choice. I feel that a rare honor to serve in this beautiful and hospitable country is bestowed upon me. I am also fortunate to lead a team of knowledgeable and dedicated experts. I practice an open door policy and I'm constantly exploring ways to help reach more people in Nepal in the shortest possible time. In this quest, I hope to also rely on your goodwill and camaraderie. I close by sharing you with the words of Mahatma Gandhi that I carry close to my heart and which I think many of you espouse. The best way to find yourself is to lose yourself in the service of others. Thank you, Dhanyavad and Namaskar.
Thank you very much, Dhanyavad, Dr. Pandav, for that inspiring thought. We'll be guided by some of the things you said, and then we'll follow up with you in our collaborative work in the days to come. Next, I think we can also speak in Nepali, so feel free to present in English or Nepali as you feel. Now we are going to listen to the FIPMO expertise. I introduced FIPMO earlier, just to add one thought that when we created FIPMO, when we established FIPMO, our idea was that this is an organization which is unique in the sense that all the members are expert in their respective field in multiple countries. They have witnessed the situation in various countries in their area of expertise. So it is that knowledge, it is that experience that we want to share. With that in mind, on COVID-19 related issues, actually 8 of our colleagues came forward to make the presentation. I will briefly introduce, and well, all the details can be shared in the social media, so I don't want to take too much of time. The first topic will be Dr. Badriraj Pandey. Of course, he's a medical practitioner, and he worked more than 8 years in World Health Organization. Mind you, I'm going to mention only the UN and the multilateral organization, but for each one of them, the whole expertise is much wider than just the UN. Then following the public health, Dr. Ramesh Sharma, who served FAO for more than 20 years, will present the thoughts on agriculture, economy, and livelihood. He is an economist. In developing this presentation, Dr. Ramesh collaborated with Dr. Purushottam Udvari, another economist who served in FAO for more. 24 years, and actually he had given some relevant thoughts on economic situation only last night in Yoho television. And Mr. Binod Sijapati, another economist who served more than 20 years in UNHCR. This is Rameshji is going to present the thoughts from these three colleagues. Then following agriculture, economy and livelihood, Mr. Vijay Rajbhandari will be presenting issues on education. Vijay Rajbhandari served UNICEF for more than 30 years in various sectors in planning, social policy, and social sector programming. Following that, Mrs. Chandani Joshi will be presenting the issue on gender rights and policy, gender mainstreaming, and institutional building issues. And she served, among many things, more than 18 years with the then UNIFEM. She was regional director in Delhi. And then finally on that series, Dr. Surendra Pandey will be talking about operations and logistics. He served in UNHCR for more than 23 years. With that introduction, now I pass the mic to Rameshji, and I will open the presentation for you. Rameshji, mic is yours.
नमस्कार है पहिला मैले गर्ने कि हेल्थको
Sorry, my apology. You are right. I got a little confused because of the file that I am supposed to open. Just give me 1 second.
जुन भए पनि के हुन्छ र जो तपाईले स्टार्ट भए पनि हुन्छ नि
हैन हामीले त्यसरी मिलाएको हुनाले
So I'm going to share the screen right now. Hazur, here we are. Dr. Pandey, we are going to start with public health. Dr. Badriraj Pandey. Each of us will take about 10 minutes. And so that I would encourage you to be precise and brief. Thank you. All yours, Dr. Pandey.
कति मिनेट भन्नुभयो 10 मिनेट हैन
हजुर
10 minutes
10 minutes please. Yes.
Okay, thank you Dr. Sir. Well, अब यो पब्लिक हेल्थ मेजर्स भनेपछि यो भास्ट आउँछ अब पहिले अहिले चाहिँ गभर्नमेन्टको चाहिँ नि जरुरतदेखि पहिले त यो कोभिड जो कोरोना भाइरस जब चाहिँ नि वुहान चाइनामा स्टार्ट भयो नोभेम्बर 2019 मा त्यसपछि नेपालमा पहिलो केस चाहिँ नि देखा पर्यो 13 जनवरी 2020 मा एकजना मेडिकल स्टुडेन्ट चाहिँ नि यो वुहानबाट he had come to Nepal carrying with him this infection अब त्यो पछि गएर चाहिँ नि कन्फर्म भयो र त्यसपछि सेकेन्ड केस आयो चाहिँ नि इन द मन्थ अफ मार्च यो 17 मार्चमा एक्चुअली a young lady she was traveling from France to Kathmandu and she was found to be positive अब त्यसैले चाहिँ नि यहाँ हामी कहाँ चाहिँ नि जब वुहानमा स्टार्ट भएको बेलादेखि नै त्यसै बेलादेखि नै यहाँ चाहिँ स्टार्ट पनि हुन थाल्यो र एउटा चाहिँ चाइनाबाट एउटा चाहिँ फ्रान्सबाट त्यस्तो किसिमबाट चाहिँ भयो र त्यसपछि अब त्यही बिचमा चाहिँ WHO ले यो पेन्डेमिक 11 मार्च 2020 मा WHO डिक्लेयर पेन्डेमिक अब त्यसपछि नेपालमा चाहिँ नि नेचुरली फ्रम दैट टाइम यो फिगर चाहिँ नि इन्फेक्सनको फिगर चाहिँ नि बढ्दै गयो चाहिँ नि अहिले करिब चाहिँ नि यो 8 लाख 8.5 लाख जति भइसक्यो र त्यसमा चाहिँ नि फर्चुनेटली 7.5 लाख भन्दै 7.5 लाख जति क्योर पनि भएको छ र 95% जति क्योर भएका छन् र nearly we have lost nearly 11,000 people due to this disease. The case fatality rate is 1.5%. अब अहिले चाहिँ अनफर्चुनेटली नेपालमा यो इन्फेक्सन अझै पनि हाई उसको छ र चाहिँ नि नेपालले चाहिँ नि यो सार्क कन्ट्रिजमा फोर्थ पोजिसन होल्ड गरेछ। सबभन्दा बढी अफगानिस्तान, त्यसपछि श्रीलङ्का, त्यसपछि पाकिस्तान र त्यसपछि नेपाल आउँछ। अब हुन त फर्चुनेटली अहिले रिसेन्टली चाहिँ नि यो फर द लास्ट विक अल्सो यो इन्फेक्सन चाहिँ अलिकति कम हुँदै गएको पनि देखिएको छ। अब पब्लिक हेल्थ मेजरको पब्लिक हेल्थ मेजरको सम्बन्धमा चाहिँ नि पहिलेदेखि नै स्टार्टिङ पोइन्टदेखि नै गभर्मेन्टको एकदम गभर्मेन्ट ह्याड फर्म भेरी गुड स्ट्राटेजिज। त्यो 3 T's भन्ने चाहिँ नि स्ट्राटेजी फर्म गरेको थियो र चाहिँ नि बहुतै राम्रो चाहिँ नि सुरुवात भयो। तर जे जति भयो बहुत स्लो भयो, इम्प्लिमेन्टेसन वाज भेरी स्लो र चाहिँ नि एक्सपर्ट्स एडभाइस एक्सपर्टिज पनि सब पाइए तापनि त्यसलाई चाहिँ त्यति फलो हुन सकेन। तर चाहिँ नि पछि गएर चाहिँ नि अब त्यो खास वास्तवमा चाहिँ नि त्यो कुनै टेक्निकल रिप्रेजेन्टेसनै भएन त्यो पोलिसी मेकिङ कमिटिजमा र चाहिँ यो मोर पोलिटिकल डिसिसन लिन थालियो र एकदम लकडाउन स्टार्ट भए विदाउट एडेक्वेट प्रिपरेसन। त्यसले गर्दा चाहिँ नि जनतालाई ठुलो हार्डसिप चाहिँ नि देखियो। त्यो आई हेभ टु गो इन्टु डिटेल, यु अल नो अबाउट इट। त्यसपछि हामी यो नेपाल पब्लिक हेल्थ फाउन्डेसनले जुन रिसेन्टली नयाँ गभर्मेन्ट आएपछि हामीले एउटा चाहिँ नि एउटा रिकमेन्डेसन गभर्मेन्टलाई दियौँ पनि कि यो थिङ्स आर नट गोइङ दि राइट वे वी थिङ्क एन्ड आई थिङ्क वी सुड गो दिस वे भनिकन सजेसन दिएको। अब त्यही बिचमा चाहिँ नि यो अहिले त सेरो प्रिभिलेन्स सर्वेको पनि रिपोर्ट आयो। अब त्यसले त झन् देखायो कि पहिलो सर्वे जो भएको थियो त्यसमा चाहिँ नि about 15% of the population मा एन्टिबडिज भइसकेको। एन्टिबडिज भन्नाले के हो भने कुनै बेलामा इन्फेक्सन भयो भने त्यसले चाहिँ बडीले जो रेस्पोन्ड गर्छ एन्टिबडिज निकाल्छ, त्यो एन्टिबडिज 15% अफ द पपुलेसनमा देखियो पहिलो सेरो प्रिभिलेन्स सर्वेमा। त्यो चाहिँ द्याट वाज डन अराउन्ड लास्ट इयर चाहिँ नि उसमा भएको थियो। एक्ज्याक्ट डेट मलाई याद भएन, करिब सेप्टेम्बर 2020 मा भएको जस्तो लाग्छ। त्यसपछि हामीले चाहिँ नि पनि गयौँ कि सेरो प्रिभिलेन्स सर्वे त यो इट हेज टु कन्टिन्यू इज ए मोर लार्जर पपुलेसन भन्दाखेरि चाहिँ नि पछि गएर सेकेन्ड वान चाहिँ अहिले हालसालै यो जुलाईदेखि अगस्तको बिचमा भयो। त्यसमा त 68.6% एन्टिबडिज नेपाली पपुलेसनमा देखिएको छ यो स्याम्पल सर्वेमा, विच इज भेरी हाई। द्याट मिन्स वी आर इन्फेक्टेड इन सम वे। पार्टली हामीले भ्याक्सिनेसनले पनि हामीलाई चाहिँ नि एन्टिबडिज फर्मेसनलाई हेल्प गर्यो, पार्टली चाहिँ नि कम्युनिटीमा स्प्रेड भइसकेको छ, त्यसले चाहिँ नि हामीलाई हामीमा एन्टिबडी आइसक्यो। यो चाहिँ नि दिस इज टु बी टेकन क्वाइट सिरियस, किनभने चाहिँ नि यो हामी चाहिँ नि एक्चुअली वी हेभ टु डु ए लट अफ थिङ्स टु कन्ट्रोल इट। अब त्यो कसरी गर्ने भन्दाखेरि चाहिँ भ्याक्सिनेसन अब स्टार्ट भयो। थ्याङ्क गड इट्स गोइङ भेरी वेल नाउ। एक्चुअली चाहिँ नि यो हिजोसम्ममा चाहिँ नि यो 17.39% अफ द पपुलेसन हेज बिन भ्याक्सिनेटेड फुल्ली, nearly 19.44% partially, which is a very good figure. Actually say the recently यहाँ यो 74th session of the regional committee भएको थियो committee meeting, त्यसमा चाहिँ नि यो even the DG WHO and SEOको RD was very happy, and the government was congratulated for doing this thing for a short time. Actually हाम्रो इम्युनाइजेसन को लागि हाम्रो स्ट्रक्चर यति तगडा छ वास्तवमा, यदि भ्याक्सिन पाइयो भने वी क्यान डु फास्टर अल्सो। र यो सब भएपछि चाहिँ अब तै पनि यहाँ यो चाहिँ यो there are many issues. अब एउटा चाहिँ नि यो इफेक्टिभ मेजर्स इन कम्युनिटी सर्वेलेन्स, यो कम्युनिटी सर्वेलेन्सलाई अझै पनि इजी लिइएको छ। अब भनिन्छ कि अब यो भ्याक्सिन आइहाल्यो, अब अलिअलि उ छँदैछ, अलिकति बुझ लगाएर त कम्युनिटी सर्वेलेन्स किन चाहियो, टेस्टिङ पनि किन चाहियो, अब के आवश्यक छैन भन्ने चाहिँ नि त्यस्तो पनि कहिले सुनिन्छ, which is very, I think it's a very wrong approach. We must have strict surveillance. We should make it wide. र त्यसमा चाहिँ नि यो र त्यो गभर्मेन्टको सर्वेलेन्सको साथै चाहिँ नि यो टेस्टिङ, यो ट्रेसिङ, कन्ट्याक्ट ट्रेसिङ गर्ने, कन्ट्याक्ट ट्रेस पोजिटिभ छ भने आइसोलेसनमा लग्ने, अब तल आवश्यक छ ट्रिटमेन्टको लागि हस्पिटल रेफर गर्ने, त्यो चाहिँ नि it has to continue very well. त्यसै हाम्रो चाहिँ नि यो health protocols जस्तो चाहिँ नि यो 3 W's भनेको चाहिँ नि SMS पनि भन्छन् भन्नलाई चाहिँ यो चाहिँ washing hands, washing masking, wearing mask and keeping distance. त्यो चाहिँ is very important. त्यसो चाहिँ त्यो पनि डिटेलमा जानु पर्दैन. त्यसै avoiding 3 C's, crowd, closed room without ventilation, particularly with poor ventilation, and this close contact. But it has to continue for a long time to come. हामीले चाहिँ नि देखाएको छौँ कि पोलियो सर्वेलेन्स has been done so well in this country कि चाहिँ नि त्यसैको चाहिँ नि एक्चुअली डिटो चाहिँ नि हामी उसमा जान सक्छौँ र यो चाहिँ अलि वाइडर बेसिसमा हुन्छ है पनि आई थिंक दैट इज एसेन्शियल. अब नेक्स्ट चिज चाहिँ नि यो उसमा यो होल्डिङ सेन्टर्स अब बोर्डरमा अब इन्डियामा एकदम म्यासिभ चलिरहेको छ. 51%ले भ्याक्सिनेसन भइसक्यो त्यहाँ है पनि छ नि म्यासिभ छ. त्यसैले होल्डिङ सेन्टर चाहिँ बोर्डर एरियामा हुनु अति आवश्यक छ. त्यो चाहिँ नि इट सुड बी गुड विथ गुड एम्युनिटिज र चाहिँ नि त्यहाँ चाहिँ नि यो बोर्डरमा चाहिँ नि यो गर्नु बहुत आवश्यक. किनभने तपाईँ सबैले पहिले पनि सुनिसक्नु भएको छ कि अब कस्तो कस्तो किस्साहरू भयो त्यो बोर्डरबाट अब्दैले कति दुःख पाए. कोही त महाकाली नदीमा भान पनि फाल्ने अवस्था पनि थियो कुनै बेलामा. मिसम्यानेजमेन्टको चरम सीमा. त्यो सेन्टरै चाहिँ नि त्यहाँ जो क्वारेन्टाइनहरू बनाइयो त्यो पनि हटस्पट जस्तो भइदियो. मान्छेहरू त्यसैले त्यसलाई छलिकन गाउँ गाउँमा गएर चाहिँ नि इन्फेक्सन फैल्यो. त्यसैले यो होल्डिङ सेन्टर चाहिँ नि अझ पनि बडो उचित लिनुपर्छ सिरियसली एन्ड इट सुड बी. अब त्यस्तै भ्याक्सिनेसन त खुब राम्रोसँग भइरहेछ तर चाहिँ नि यो क्लोज इन्भाइरोमेन्टमा होइन सकेसम्म ओपन इन्भाइरोमेन्टमा यो अन्डर द टेन्ट हो भने विथ फिजिकल डिस्टेन्सिङ त्यो हो भने इट विल बी सेफर. अब COVID-19 चाहिँ इज बिहेभिङ भेरी फनीली. त्यसको म्युटेसन भनिकन डिफ्रेन्ट भेरिएन्ट्स आइरहेको छ. अहिले जो छ डेल्टा भेरिएन्ट भन्ने त्यो चाहिँ इट हेज सब वर्ल्ड वाइड चाहिँ फैलिएको छ र चाहिँ त्यसले चाहिँ नि इट इज भेरी हाइली इन्फेक्सस र साथै चाहिँ नि यसले पनि गर्छ. त्यसले चाहिँ नि अब एज ग्रुप पनि चेन्ज भयो. पहिले आफ्टर 60s लाई बढी चाहिँ नि ऊ भनेर भन्थे. अब यङ्गर एज ग्रुप इभन 18 to 35 एज ग्रुपलाई बढी चाहिँ नि एफेक्ट हुन थालेको छ. त्यसैले चाहिँ नि वी हेभ टु बी भेरी केयरफुल अबाउट दिस monitoring this behavior of the COVID-19 and do things accordingly. अब अहिले त म्यू भेरिएन्ट भन्ने पनि आइसक्यो. म्यू भेरिएन्ट आइसकेको छ तर अहिले त्यति त्यसले नोक्सान गराएको जस्तो देखिन्न. तर त्यो पनि यु नेभर नो. र यो चाहिँ हामीले बुझ्नुपर्छ कि जबसम्म सबै संसारमा सबैले भ्याक्सिनेटेड हुँदैनन् र चाहिँ नि भ्याक्सिनेसन कहीँ चाहिँ नि 1% 2% नहुने कहीँ चाहिँ नि जस्तो चाइना त 1 बिलियनले लिइसके फुल्ली भ्याक्सिनेटेड भइसके भने यस्तो चाहिँ डिस्प्यारिटी भएसम्म चाहिँ नि यो COVID-19 चाहिँ नि जाँदैन र चाहिँ नि यो म्युटेसन हुँदै जान्छ र चाहिँ नि इट विल एभर रिमेन ए पेन्डेमिक. त्यसैले चाहिँ नि इट हेज बिन त्यो इक्विटेबल एक्सेस टु भ्याक्सिनेसन इज भेरी भेरी इम्पोर्टेन्ट. र यो सन्दर्भमा चाहिँ अहिले फेरि नयाँ चिज यो पनि देखिया छ कि यो जो भ्याक्सिनेटेड मान्छेले पनि ब्रेक थ्रु इन्फेक्सन भन्छ कि चाहिँ नि भ्याक्सिनेटेड मान्छेलाई पनि यो रोग चाहिँ नि देखिएको छ. त्यस्तै लङ कोभिड भन्ने एउटा चिज आएको छ. मान्छेलाई चाहिँ नि महिनौँ दिन चाहिँ नि यो कन्टिन्यू भइरहन्छ. अब त्यस्तै चाहिँ नि बच्चाहरूमा चाहिँ नि यो एउटा चाहिँ नि मल्टी सिस्टमिक सिन्ड्रोम चाहिँ नि डेभलप भएको छ. अब यी विभिन्न चिज चाहिँ आइरहेको छ. त्यसैले वान हेज टु लुक इन्टु इट, मोनिटर भेरी केयरफुल्ली एन्ड गो फरवर्ड. अब त्यसै रिसर्च सबै डिफ्रेन्ट टाइप अफ रिसर्च आर नेसेसरी.
डाक्टर पाण्डे एक मिनट बाँकी है. सरी
अब effective intersectoral coordination, I don't have to go into detail, that is very necessary. Stakeholders should be engaged. All the community community like involved गर्नु पर्यो. Media को support चाहियो public-private partnership is very, very important, but the public sector, the private sector should be regulated. The hardships, the even money-wise, finance-wise, the people have to bear in private hospitals, in centers. This cannot be good. This has to be controlled in some way. So, Himalaya Center data information नेसन वाइड अपडेटिङ अफ इन्फर्मेसन र म त भन्छु कि हरेक चाहिँ वडा वडामा यो ड्यासबोर्ड राख्दिने त्यहाँ चाहिँ सबै जो पर्टिनेन्ट इन्फर्मेसन राख्दिने यति केस छ यति भयो भने यति भ्याक्सिनेसन भयो भने सबै हो ताकि जनतालाई पनि थाहा होस् जनताले पनि फिल गरोस् कि ए we have to be involved, we have to do things to भनिकन त्यसमा जानु पर्यो र अब त्यसैले चाहिँ नि यो अब होम क्यारी मेसेज चाहिँ नि के हुन्छ भने एउटा त COVID-19 is going to stay for a long time to come. Personal behavior changes are absolutely needed, but each individual should observe the SMS 3 Ws भनौं and चाहिँ नि avoid 3 Cs र चाहिँ नि अनि यो प्र्याक्टिस चाहिँ नट ओन्ली कोभिड यसको चाहिँ नि अरु चाहिँ नि उलाई पनि वर्ल्ड अफर पनि यसले ठुलो मद्दत गर्छ अर्को चाहिँ नि भ्याक्सिनेसन जहिले पनि मौका पाए कि भ्याक्सिन दिनै पर्छ अब त अरु कन्ट्रीजमा त यो डेभलप कन्ट्रीमा थर्ड डोज पनि आइसक्यो अब हामी पुअर कन्ट्रीज वी हैव नट रिसिभड इभन one dose, so it has to go. We have to make a solid effort, and COVAX society WHO goes how it has done such a wonderful thing, and we should all support it. We should make our voice loud and clear that we need vaccines, and there is no compromise to inequity in this matter. So to say, COVID lastly, COVID has given opportunity to government also to look into its own health system and to ensure that there is a resilient health system with good infrastructure, improve quality of service, and develop a strong public health system at large. The COVID challenge has given us opportunity to reform ourselves. Thank you very much. Thank you.
Thank you very much, Dr. Pandey. My apologies, sorry, time come my boy. So this is also a challenge for us. It's not only that how much we know, but how we can fit in the limited time. So we'll go to the next speaker. There was a suggestion, Dr. Pandav rightly pointed out that the screening, the testing, COVID testing need to be enhanced in Nepal because the actual reported incident and what you described as the antibody presence, there is a big gap between the test reported and antibody presence. So that means the test has to be increased, and that will give other options can be implemented after that. Thank you very much. Next, Dr. Ramesh Sharma, it is yours. The mic is yours.
Thank you, Suresh ji. Basically, pani poryo, site ramro bhas laga malai.
Good. If I can make a request, wherever possible, if you can also explain things in English, because we have a few participants, which will be, although they do understand Nepali, it will be useful if there is some English conversation as well. Thank you.
Yeah, we'll try speaking in Nepangrej to the extent possible. Yo chani joint preparation Puruji, Binod ra buku garera sallah garera banayeko. Basically, aba यसमा चाहिँ दुईटा parallel track मा चाहिँ एउटा इकोनोमी बिजनेस इन्डस्ट्रीहरुको इम्प्याक्टहरु जुन हामी काठमाडौँ बसेका नाताले वर्ता सुनिन्छ त्यो बारेमा एउटा त्यो ट्र्याक छ त्यो एसेसमेन्ट गर्नेमा अर्को चाहिँ नि हामीले धेरै चाहिँ नि बाहिर नगइकन नसुनिनी रुरल फुड सेक्युरिटी सिचुएसन भयो रुरल इम्प्लोयमेन्ट भयो लाइभलीहुड भयो त्यो खालको किसिमको ट्र्याक छ त्यसको चाहिँ नि एसेसमेन्ट चाहिँ नि ब्रिफली चाहिँ नि के छ भन्ने कुरामा चाहिँ नि सबभन्दा पहिले अब इकोनोमी जीडीपी नेसनल एकाउन्ट्सको डेटामा चाहिँ नि पहिला चाहिँ नि 2019-20 मा गभर्नमेन्टको त्यसमा चाहिँ नि इकोनोमी चाहिँ नि श्रिङ्क हुने भनेर भनेको छ हैन 2.1% ले श्रिङ्क हुने फर द फर्स्ट टाइम आफ्टर मेनी इयर्स भन्ने छ त्यसमा चाहिँ इन्डस्ट्री सर्भिसेज सबै श्रिङ्क हुने खाली एग्रिकल्चर मात्रै चाहिँ नि कन्टिन्यू टु ग्रो एट 2% भन्ने थियो त्यसपछिको 2020-21 टु फिस्कल 2021 मा चाहिँ नि निकालेको चाहिँ नि सीबीएस अथवा बजेट स्पिचहरुमा निकालेको स्ट्याटिस्टिक्समा चाहिँ नि सबै पोजिटिभ किसिमको देखाएको छ तर त्यो चाहिँ नि एक किसिमले मिसलिडिङ छ भन्ने कुरा सबैले रियलाइज गरे किनभने त्यो भेरी लो बेसबाट मेजर गरे हुनाले सबैभन्दा राम्रो देखिएको क्या बेस इफेक्ट भन्छ नि यदि चाहिँ नि त्यसलाई चाहिँ नि 1 वर्ष अगाडिको नर्मल टाइमबाट मेजर गर्ने हो भने 2020-21 मा पनि धेरै कुरा नेगेटिभ आउँछ इन्डस्ट्री जहाँ चाहिँ नि 80% चाहिँ नि इन्डस्ट्री कन्स्ट्रक्सन म्यानुफ्याक्चरिङ र इम्प्लोइमेन्ट 75-80% इम्प्लोय गर्ने सेक्टरहरूको ग्रोथ नेगेटिभ आउँछ यदि अहिलो वर्षको नर्मल बेसबाट गऱ्यो भने सीबीएस कोमा पोजिटिभ देखाएको छ तर नेगेटिभ छ त्यो सर्भिसेजमा त्यस्तै छ जुन मुख्य इम्पोर्टेन्ट सर्भिसहरू होलसेल ट्रेड ट्रान्सपोर्टेसन यो सबै नेगेटिभ आउँछ त्यो अहिलो बेसबाट हेर्ने हो भने भन्दा खोजेको के भने 2021 को फिस्कलमा पनि यदि चाहिँ नि अहिलो वर्षको नर्मलसँग कम्पेयर गर्ने हो भने इकोनोमीको सिचुएसन चाहिँ नि ज्यादै नराम्रो देखिन्छ इम्पोर्टेन्ट सेक्टर्सहरुमा र यो वर्षको लागि चाहिँ नि अब राम्रो हुन्छ भन्ने छ हैन अब त्यो राम्रो पनि होला जस्तै देखिन्छ यसो हेर्दाखेरि यो कोभिडको प्रोग्रेसले गर्दाखेरि इन्जेक्सनहरुको यो कारणले प्रोग्रेस गर्दाखेरि हुनुपर्छ जस्तो लाग्छ मलाई तर लास्ट 2 इयर्स टु फिस्कल इयर्समा चाहिँ नि नेगेटिभ र स्ट्याग्नेन्ट नै छ सबै ठाउँमा स्पेशली 2018 को आईएलओ को इम्प्लोइमेन्ट सर्वेको डेटा र जीडीपी को डेटालाई कम्बाइन गरेर हेर्दाखेरि जुन चाहिँ नि सेक्टरमा चाहिँ नि हाई इम्प्लोइमेन्ट इन्टेन्सिभ सेक्टर्सहरु छन् त्यो सेक्टरहरुमा सबभन्दा बढ्ता हिट भएको छ जस्तो ब्याङ्किङमा हार्डली 2-4 जना मान्छे इम्प्लोय हुने ठाउँमा ब्याङ्किङको राम्रो छ हैन तर जुन ठाउँमा लार्ज स्केलमा चाहिँ नि मान्छेहरु इम्प्लोय हुन्छन् त्यो ठाउँमा चाहिँ सिचुएसन चाहिँ नि नेगेटिभ भएको देखिन्छ एउटा त्यो किसिमको एसेसमेन्ट छ र पोर चाहिँ नि र अहिले गरेर 7-8 वटा चाहिँ नि अरु स्टडीजहरु छन् जुन चाहिँ नि भनौं न एक किसिमको इन्डस्ट्री बिजनेसहरुको सर्वे गर्ने खालको स्टडीजहरु छन् र अर्को चाहिँ नि रुरल एरियाको एग्रिकल्चरको लाइभलीहुड यस्तो छ त्यसमा चाहिँ नि म एउटा चाहिँ नि दुईटा ब्रिफली चाहिँ नि नेपाल राष्ट्र बैंकले गरेको अहिलेको रिसेन्ट सर्वे इन्डस्ट्री बिजनेसको सर्वे चाहिँ नि भर्खर 1 महिना जति भयो पब्लिश गरेको त्यो अनुसारको चाहिँ नि पिक्चर चाहिँ नि अहिले 80% इन्डस्ट्री बिजनेसहरु इन अपरेसन भनेर गरेको छ कम्पेयर टु चाहिँ नि 30-35% अपरेसन 1 वर्ष अगाडि भन्दाखेरि त्योबाट 80% फुल अपरेसन भनेको चाहिँ नि अब इन्डस्ट्री बिजनेसको लागि चाहिँ नि राम्रो छ त्यस्तै इम्प्लोइमेन्ट र स्यालेरी पेमेन्टमा पनि इन्डिकेटर्सहरु धेरै इम्प्रुभ भएको छ अघिल्लो वर्षको कम्पेरिजनमा भर्खर आएको चाहिँ नि र स्टिल उनीहरुको त्यो सर्वेमा चाहिँ नि उनीहरुको कम्प्लेन्ट्सहरु रेकर्ड गर्दाखेरि अहिले यो रेस्पोन्स दिएको मेजरहरु जस्तो कि बैंक लोन इत्यादि लोन पाउनु अझै पनि गाह्रो छ डिफिकल्ट छ भन्ने कुरा उनीहरुले भनेका छन् तर एक किसिमले आउटलुक चाहिँ नि धेरै इम्प्रुभ भएको देखिन्छ बिजनेस र इन्डस्ट्री होटलहरुको सर्वेमा होटलहरु त खतम भइहाल्यो त्यो बाहेक बिजनेसहरुमा अब अर्को ट्र्याकको स्टडीजहरुको एउटा रिप्रेजेन्टेटिभ चाहिँ नि 7-8 वटा मैले भने त्यसमा सबभन्दा कम्प्रेहेन्सिभ र सबभन्दा डिटेल स्टडी चाहिँ डब्ल्युएफपी को सर्वे जुन चाहिँ नि यो 4th हो 1 वर्षमा भल्नरेबल एसेसमेन्ट सर्वे भ्याम भन्छ 6000 हाउसहोल्ड चाहिँ नि अल रुरल हाउसहोल्ड्सलाई डाइरेक्ट फोनबाट कन्ट्याक्ट गरेर अरु किसिमले कन्ट्याक्ट गरेर उनीहरुको फुड सेक्युरिटी सिचुएसन इन्डिकेटर्सहरु छ जसको आधारमा र लाइभलीहुड भन्दाखेरि इम्प्लोइमेन्ट अथवा जब र इन्कम लसेसहरुको यो इन्डिकेटर्सहरुको आधारमा उनीहरुले सर्वे गरेको भर्खर अहिले पब्लिश भएको छ यही महिनामा अहिले 2-4 दिन अगाडि त्यो अनुसारको चाहिँ नि फुड सेक्युरिटी जुन चाहिँ डायटरी डाइभर्सिटी फुड इनएडिक्वेसी इत्यादि इन्डिकेटर्सहरु छ त्यो अनुसारको चाहिँ नि लेभल चाहिँ नि हाई नै छ तर 1 वर्ष अगाडिको कम्पेरिजनमा चाहिँ नि फुड सेक्युरिटी इन्डिकेटर्समा अलिकति इम्प्रुभ देखाएको छ फुड कन्जम्पसन डायटरी डाइभर्सिटीमा तर लाइभलीहुड डिस्ट्रप्सन जसमा चाहिँ नि जब र इन्कम लसेस पर्छ त्यसको चाहिँ नि पहिलाको भन्दा अहिले चाहिँ नि वर्सन भएको छ सबै इन्डिकेटर्सहरुमा जब लसेसहरु र इन्कम लसेसहरु प्लस त्यसले के पनि देखाउँछ भने जुन चाहिँ नि क्युमुलेटेड खालको इफेक्ट्सहरु हाउसहोल्डहरुमा रिस्क बियर गर्न सक्ने क्यापेसिटी पहिलाको कम्पेरिजनमा अहिले चाहिँ नि त्यसमा वर्सन भएको देखाएको छ र रिजनल डिस्प्यारिटिजहरु झन् 7 वटा प्रोभिन्सको रिजनल डिस्प्यारिटिजहरु पहिलाको भन्दा अझ बढी वाइडन भएको देखाउँछ त्यसकारण यो ऐनाको जुन आउटलुक छ त्यो बिजनेस र इन्डस्ट्रीको आउटलुक र यो आउटलुकमा चाहिँ नि निकै चाहिँ नि फरक किसिमको एसेसमेन्ट छ त्यसैले हामीले जेसुकै हेर्दाखेरि पनि अब बिजनेस इन्डस्ट्री होटलको सोच्ने धेरै से मन त्यतातिर जान्छ तर यो भास्ट नेपालको रुरल एरियामा भए प्रब्लमहरुको चाहिँ नि अलि अटेन्सन कम हुन्छ तर यहाँ चाहिँ नि सिचुएसन चाहिँ नि अहिले पनि त्यतिकै नराम्रो देखिन्छ अब 2-4 मिनेट गइसक्यो होला हैन अब अर्को एकताली हेरौँ यो नेक्स्ट स्लाइडमा चाहिँ नि गभर्नमेन्टले के गर्यो भन्ने कुरा रेस्पोन्स मेजर्सहरु यो 8-10 वटा चाहिँ नि त्यहाँ लिस्ट गरेको छ यो चाहिँ नि गभर्नमेन्टको बजेट स्पीचमा चाहिँ नि 30-40 वटा प्याराग्राफमा लेखेका कुराहरुको एक किसिमले मेन जिस्ट जस्तो भयो यसमा चाहिँ बेसिकली दुई किसिमकोलाई क्याटेगोराइज गरेको छ एउटा चाहिँ बैंकको लिक्विडिटी बढाउने रिफाइनान्स फेसिलिटी इन्ट्रेस्ट रेट सब्सिडी जम्मै थ्रु बैंकबाट मोनेटरी पोलिसीको थ्रुबाट बेसिकली इन्डस्ट्री बिजनेसहरुलाई चाहिँ नि सपोर्ट गर्ने किसिमको मेजर्सहरु छन् अर्को चाहिँ नि जसलाई हामीले सोशल प्रोटेक्सन भनेका छौं इम्प्लोयमेन्ट जब फुड सब्सिडी इत्यादि इत्यादि खालको डाइरेक्ट फुड रिलिफ यो खालको क्याटेगोराइज गरेर प्रशस्त छ त्यो बजेट स्पीच हेर्ने हो भने 30 वटा जति प्याराग्राफमा चाहिँ नि उ गरेको छ अब एउटा कुरा के छ भने यो लिस्टिङ चाहिँ नि बैंकिङ र उसको लिस्टिङ हेर्ने हो भने अरु देशको र हाम्रो देशकोमा चाहिँ नि लिस्ट कम्पेयर गरेर हेर्ने हो भने धेरै फरक मोनेटरी पोलिसी जुन पहिलाको उसमा छ बैंकहरुको मोनेटरी पोलिसीकोमा खासै फरक देखिदैन जुन देशमा पनि इजी मनी र यो फन्ड्सहरु गरेको छ अब कहाँ फरक आउँछ भने सोशल प्रोटेक्सनमा किन फरक आउँछ भने कुनै कतिपय देशमा चाहिँ नि एउटा किसिमको एउटा रिलिफ प्रोग्रामहरु फुड सब्सिडीहरु इन्कम ट्रान्सफरहरुको सिस्टम पहिलादेखिको गरेर हुनाले उनीहरुले त्यसलाई एक्सप्यान्ड गर्ने भयो त्यो देखिने भयो जस्तै इन्डियामा पब्लिक डिस्ट्रिब्युसन सिस्टम इन्डोनेसियामा त्योहरु छ अमेरिका यस्तो चीज केही पनि नभएको हुनाले लिस्ट चाहिँ नि ठ्याक्कै मिल्दैन सोशल प्रोटेक्सन उनीहरुको र हामीहरुको चाहिँ फरक पर्छ लिस्टमा सेकेन्ड लिस्टहरुमा जुन ठाउँ जुन देशमा सिस्टमहरु छ पहिलेदेखिको रिलिफ प्रोग्रामहरु यो स्किम्सहरु इन्स्टिट्युसन्सहरु छ त्यो ठाउँमा त्यो कन्टिन्यू गर्ने एक्सप्यान्ड गर्ने हुन्छ नत्र हामी कहाँ यस्तो यो त्यसको बारेमा अब तेस्रो उसमा चाहिँ यसको बारेमा अलिकति कमेन्ट्रीहरु बेसिकली अब एउटा हेडिङमा चाहिँ कमेन्ट्री चाहिँ बनाएको
May I request you to mute your microphone, please? Okay, Ramesh, please carry on. Ramesh, mute छ तपाईको सुन्निएको छैन
म्युट अरुले म्युट गर्दै कि क्या हो मेरो आफै कसरी म्युट
होइन त्यहाँ एडमिनले सबैलाई म्युट गराखेरि तपाईको पनि पर्यो
ए त्यो गरेको ठीक छ अनि बेसिकली यो लिस्टको बारेमा दुई तीनटा कमेन्ट्री चाहिँ नि अर्को जुन स्लाइड लास्ट स्लाइड भनेको छ त्यसमा चाहिँ नि थर्ड स्लाइडमा चाहिँ नि कमेन्ट्री गरौँ एउटा चाहिँ नि के छ भने रेस्पोन्स प्याकेजमा हामीहरुले हाउ शुड वी भ्यू द प्याकेज एज ए होल भन्ने क्वेशन हैन यो गर्दाखेरि एउटा चाहिँ नि अब हामीहरुले चाहिँ नि यसको चाहिँ नि एडिक्वेसी अफ द रेन्ज अफ मेजर्सहरु को एउटा एंगलबाट हेर्नुपर्ने हुन्छ र अर्को चाहिँ नि ब्यालेन्स अफ द उहरु चाहिँ कुन के गरेछ भन्ने एडिक्वेसी भन्ने हेर्ने कुरा के भने जुन चाहिँ नि अब रेन्ज अफ प्रब्लम्सहरु जुन चाहिँ नि बिजनेस र होटलहरुको अलावा रुरल एरियाजको प्रब्लम माइग्रेन्ट्सहरुको प्रब्लम यो सबै चीज हेर्दाखेरि चाहिँ नि एउटा दुईटा तीनटा मात्र भएर पनि हुँदैन 10-12 वटा किसिमको सोशल उहरु चाहिन्छ रेस्पोन्स सोशल प्रोटेक्सन मेजर्सहरु चाहिन्छ भन्ने कुराहरु त्यो एंगलले हेर्दाखेरि चाहिँ नि भनौं न 10-12 वटा हुनु चाहिँ नि राम्रो हो भन्ने कुरा हो किनभने वी वान्ट टु रिच एज मेनी भल्नरेबल ग्रुप्स एज पोसिबल, त्यसले गर्दाखेरि डिफ्रेन्ट किसिमको रेस्पोन्स मेजर्सहरू चाहिन्छ, त्यो एङ्गलबाट ठिकै छ। अर्को एउटा चाहिँ के एङ्गल छ भने यसको ब्यालेन्स, अब यसको कुनमा कति पैसा खर्च भयो, कसले बेनिफिट गर्यो भन्ने कुरा हुन्छ। अब यो एउटामा चाहिँ अलिकति डिस्कसन डिबेट गर्नु चाहिँ राम्रै हुन्छ। अब यसमा बङ्गलादेशको ब्राक युनिभर्सिटीले गरे एउटा भर्खर निकालेको एउटा स्टडीमा यो चिजले एड्रेस गरेको छ। हामीहरू कहाँ यसमा छलफल भएको मैले देखिनँ। जस्तो उनीहरूले के पायो भने 80% अफ द टोटल बजेट, 4% अफ द जिडिपी चाहिँ जुन उनीहरूले रेस्पोन्स गर्यो दुईटाको टोटलमा 80% चाहिँ नि मोनिटरी साइडबाट पहिलो रिकभरी रिलिफ क्याटेगोरीमा गएर ओन्ली 20% अन सोसल प्रोटेक्सनमा मात्रै खर्च भएको उनीहरूले पायो। त्यो चाहिँ नि उनीहरूको विचारमा त्यो रिपोर्ट गर्ने मान्छेहरूको विचारमा ज्यादै रिग्रेसिभ र ज्यादै चाहिँ नि बायस टुवर्ड्स बिग बिजनेस र चाहिँ नि एक किसिमको उनीहरूले बङ्गलादेशको पोलिटिकल इकोनोमी, त्यहाँको पोलिटिकल सिस्टम इत्यादिसँग लिङ्क गरेर हेरेको छ उनीहरूले। अब हाम्रो जस्तो समाजवादतिर लम्किसकेका देशमा त त्यो भनौँ न 80-20 नभएर 60-40 हुनुपर्ने हो कि 65-35 हुनुपर्ने हो कि, तर यो मेजर गरेका छैन। तर धेरै ठाउँमा चाहिँ के छ भने मनी, इजी मनीबाट हेल्प गर्ने शैली हुनाले बेपत्ता त्यतातिर जाने र सोसल प्रोटेक्सनको सेयर कम हुने हुन्छ। र अर्को कुरा के छ भने यो सपोर्ट पनि धेरै जसो त्यो फर्स्ट क्याटेगोरीको सपोर्टहरू चाहिँ नि लार्ज बिजनेस, लार्ज इन्डस्ट्रीमा कन्सन्ट्रेट भएको स्टडिजहरूले देखाउँछ। जति तल
एक मिनेटमा सकौँ है अब।
हस्, जति तल सपोर्ट तल्लो लेभलमा गयो त त्यो चाहिँ नि सपोर्ट चाहिँ नि कम हुँदै जाने हुनाले यो ज्यादै रिग्रेसिभ भयो र यसमा चाहिँ नि हामीहरूले पनि छलफल गर्नुपर्छ भन्ने एउटा चाहिँ नि हामीहरूको एउटा विचार हो। अनि दोस्रो कुरा चाहिँ नि अब सोसल प्रोटेक्सनमा चाहिँ नि हामीहरूको चाहिँ नि राम्रो सोसल प्रोटेक्सन पहिलेदेखि नभएको हुनाले भर्खर सुरु गरेका प्रोग्रामहरू मात्रै छन्। जस्तो प्राइम मिनिस्टर इम्प्लोइमेन्ट प्रोग्राम सबभन्दा ठुलो, त्यो चाहिँ नि 16 अरबको भयो। त्यस्तै स्टार्टअप बिजनेसको लोनको विभिन्न सब्सिडी स्किम्सहरू, यो कृषिमा स्पेसल्ली यो फर्केको मान्छेहरूलाई ल्यान्ड लिज गर्ने, यो सबै चिजहरू चाहिँ नि नयाँ चिजहरू, एक किसिमले नयाँ चिजहरू सब्सिडी बाहेक र नयाँ भएको हुनाले त्यसमा चाहिँ नि राम्रो रेकर्ड कुनैमा पनि छैन। जस्तो कि अब यदि अडिटर जनरलको रिपोर्ट हेर्ने हो भने सबभन्दा इम्पोर्टेन्ट चाहिँ सबभन्दा ठुलो इम्प्लोइमेन्ट प्रोग्राममा पिएम इम्प्लोइमेन्ट प्रोग्राममा 5-7% मात्रै प्रोग्रेस भएको भनेको छ। यो 40 पेजको अडिट पर्फर्मेन्स रिपोर्ट हेर्दाखेरि ठ्याक्कै त्यस्तै लाग्छ, भद्र गोल छ त्यसमा। त्यस्तै स्टार्टअप बिजनेस त सुरु भएकै रहन्छ, मैले सिंहदरबारभित्र घुमिरहेको छ मन्त्रालयहरूमा। सब्सिडीहरूमा भएको अनेक किसिमका लिकेज र मिसयुजहरूको बारेमा 4-5 वर्षदेखिको हामीले पढिराखेकै छौँ होइन। त्यसले गर्दाखेरि चाहिँ नि यो अवस्था चाहिँ नि ज्यादै नराम्रो भद्रगोल छ। के गर्ने पर्छ भन्ने कुरा पनि सबै थाहा छ, तर गर्न नसकिने अवस्थामा हामी फसिराखेका छौँ। र त्यसले गर्दाखेरि चाहिँ नि यो सोसल प्रोटेक्सनको पार्टबाट चाहिँ कति मद्दत होला भन्ने कुरामा चाहिँ नि यी सबै चिजलाई विचार गर्ने हो भने बिग क्वेसन मार्क छ। ब्याङ्कबाट गर्ने हेल्पबाट चाहिँ नि राम्रो भएको देखिसक्यो, तर सोसल प्रोटेक्सन साइडबाट चाहिँ नि के होला भन्ने कुरामा चाहिँ नि ठुलो क्वेसन मार्क छ। ल एउटा लास्ट पोइन्ट एउटा मात्रै पाइन्छ, यो बिल्डिङ क्यापेसिटीमा हुन त पछि गरे पनि हुन्छ। यो लोकल गभर्मेन्टबाट चाहिँ नि एउटा बिग होप चाहिँ नि हामीले देखेको चाहिँ नि एउटा लोकल गभर्मेन्टबाट नै सबभन्दा राम्रो हेल्प र सबभन्दा इफेक्टिभ र रिच हुने, सबैलाई युज हुने लोकल भनेको जस्तो हाम्रो यसमा वडाहरूबाट, पालिकाहरूबाट, किनभने उनीहरूलाई चाहिँ नि प्रब्लमहरू थाहा हुनाले हामीले चाहिँ नि केही मद्दत गर्न सक्छौँ भने भनौँ न, हामी भने फिप्मो अथवा अरू कसैले सक्छौँ भने पालिका लेभलमा, वडा लेभलमा, सबभन्दा राम्रो वडा लेभलमा यो तथ्याङ्क गर्ने, प्रोजेक्ट छान्ने कुराहरूमा, इभ्यालुएसन गर्ने, ट्रान्सपेरेन्सीको सिस्टम बनाउने कुरामा यो सिंहदरबारबाट चाहिँ नि केही हुनेवाला छैन। यो गर्ने हो भने के हुने छ भने वडा लेभलमा, पालिका लेभलमालाई स्ट्रेन्थेन गरेर गऱ्यो भने चाहिँ नि हुने देखिन्छ। होइन भने अर्को 3-4 वर्ष यही किसिमले कन्टिन्यू हुन्छ, त्यसपछि चाहिँ के होला भन्न सकिने अवस्था छैन। हस्, धन्यवाद।
हस्, थ्याङ्क यू भेरी मच रमेशजी। यो अन्तिम पोइन्ट जुन तपाईँले भन्नुभयो एकदम रिलेभेन्ट भयो, किनभने फिप्मोको उद्देश्य नै हाम्रो भएको, हामीले जानेको कुरोले हामी कसरी यहाँ कन्ट्रिब्युट गर्न सक्छौँ भन्ने हो। त्यसकारण वडाहरूलाई, स्थानीय तहलाई अलि राम्रो बनाउन, सुदृढ गराउन हाम्रा सदस्यहरूको केही सहयोग चाहिन्छ भने हामी तयार छौँ भन्ने कुरो हामीले गर्दै आएछौँ, फेरि पनि गरौँला। थ्याङ्क यू। अब तेस्रो प्रेजेन्टर हुनुहुन्छ विजय राजभण्डारी शिक्षाको बारेमा। विजयजी, इट्स योर्स।
Thank you everyone and namaste to all. Well, your participant list I just happened to look at the participant list, and we have the international listener as well. So I would like to respect that and then try to go by the English one as much as I could. So I think there is already a history to what happened with Corona when it came, how it started and all that from Dr. Badraj Pandey. So I will go straight to the education part. As we know, I think education is, it has largely affected. The schools were closed on 19th of March 2020. Actually, it shut down almost like 9 million children. They were locked out of the school. So they could not go to school, and even the exams for grade 10 has to be postponed just before the Corona epidemic. Actually, the government tried to do something about it. They first started off with TV and radio systems. I have seen myself in many schools in Panskal and also in other schools around around Katmanu that it simply didn't work, because the teacher was just telling it's a kind of one-way communication. So I could see that it was not working and teachers were not listening. There was a huge issue of the access and continuity was an issue. This could not be continued, so they left that out, and they went into the internet connectivity, which also could not be sustained. As you know that actually Nepal has almost like 80% children who go to the public schools, that's the government supported schools, and 20% into the private schools. So it clearly showed the digital divide in this pandemic time. The children who were in the private school, most of them have access to the internet and they could continue their learning. Whereas in the public schools, they simply could not. So there was a survey done by UNICEF and others saying that the access of education to the public school is very, very poor. And recently, there was a survey done by UNICEF in July 2021, which shows that it talked about the quality of learning, and it says that there were only almost 90% of the children, they forgot what they were taught. So that whole knowledge of learning is gone actually. Government also has come up with a contingency plan. I had to look at those plans, and then they have created the various scenarios where when the school opens up, what will they do? But the school is just opening up actually. That's what the government has planned, despite there is a lot of resistance from the parents. But let's see what happens from Asin Ekate when the government opens up the schools. But I think there is still a problem in terms of the educations in that. Second is, I think the whole, despite of the effort of the government to continue with the TV and the radio programs, we still have a huge problem of the internet access. There are only 55% of Nepal actually reached out on the internet, and 51% students have access to radio. I think that digital divide in Nepal is a huge issue, which actually deprive the children of getting access to the education. Next one, please. Second issue I really would like to bring it up is also the mental health issues. And I'm sure Dr. Pandav is listening and will be interested to comment on that as well. I think this is one of the issues because this affected the children because they lost the routine because they used to dress up and go to the school, which they could not do. There is a closure of the schools. Their movements were restricted. They could not do any of the physical activities. They could not meet the friends. They were locked up into their houses. So that created a lot of uncertainties and unpredictability among the children, and which actually created a lot of mental stress and mental pressure on the children as well. So actually, this has got, and there is also the fear of infections, and that's true to even to all of us. So they were worried about getting the infections to themselves and to others as well. So that fear factor is also with them, and this actually happens more to the children with the differently able children. Actually, they get more affected, especially for example, autism. The children with autism get more more arrogance and things like that because they were locked the house. They could not interact with the others. And I was just referring to one of the surveys done in India. It's the Childline, and they have Childline. Having worked in India, I think it works pretty well in India. And they have showed that since the corona came in, the number of calls that were made is actually up by 50%. So I think that also showed that there's a stress on the children as well. This also affected the poverty as well, and then because the children who were already in the marginalized situation, they lost a job, as we heard from Rameshji. Many people lost a job, and that also affects the children as well, because they have to depend on their parents, and the children are the ones who will be the first hit when there is a economic stress at home. So I think that also affected the children on that. There is also the dropout. I think dropout is one of the huge issues in Nepal, especially in the Tarai regions. So I think the children, there is likely that children who actually likely to leave the schools, there will be a high number of coming to that. And it is especially the girl children who will be affected by that kind of dropout. So I think this is increasingly becoming a problem, and then we don't know how many children will come back to schools. The data also shows that when the children are on the poverty lines, they are the ones who are made to work. They are the ones who are actually supposed to be asked to go and work somewhere else. So I think this also there's a lot of exploitations to especially girl children. As we have seen, the examination delayed, that has really affected many of the children. Their uncertainty, they have certain plans to go abroad. I think that really affected. And also, I think recently we have seen in the grade 10 exam, because it came out from the school itself. It's the school who actually give the marks. So actually, that is something many organizations are refusing to believe that these are the actually numbers, because we have seen that when there was a board exam, how much GPA one got, and then now when the school was giving the scores, how much GPA children got. So I think there is a huge difference in that, and also I think this also brought the issue of the decentralizations, issue of the board exams, because now with the decentralizations, we have seen that many of the schools are actually under the municipalities. So actually, they are the ones who actually go back and tell them, okay, what to do with your mark sheets and all that, and everybody jacked up their scores. So I think that also shows that whether we should decentralize the education to the municipality level or not. I think that's something the question has come up. I think on the positive note, I could see that there is after the pandemic, there was a more innovative approach of teaching has come up. I have known quite a few who have come up with the softwares, and I hope that the ICT plans of the government, which was actually planned in 2000, will actually materialize. The policy will materialize sooner than later, so that when we have the situation like this, actually it can be sort of applied. I have seen many of the schools where the teachers actually quickly learn about it because they did not want the children to suffer. So they quickly got together and then found a way to address the issues and teach the children. So they also gave the opportunity for the teachers for the quick learning on the online systems. So it is true with all the teachers and students alike. They all picked up how to do the teaching and also do the learning. I just saw today in the Twitter, actually, the desire of learning. I just take like half a minute for that example. This is in Sankosova, where a boy was actually going to the tree, top of the tree every day, so that he could get the Zoom and then learn. And then since it was not possible for him to do every day, he actually made a small room for himself to learn. So actually the desire is so much for the children to learn. So I think that is something the government to really become serious about expanding the internet and the TV systems in the near future. So this will be one of the youth suggestions to the government. Yeah, thank you everyone.
Thank you, BJG, right on time. Excellent. I don't see any comments at this stage. So we will move to the next presenter, Chandni Joshi,
Yes.
Over to you.
Yes, thank you. A very good afternoon. Our reverend patron, Himalayan Samsadju, respected Dr. Rajesh Pandav, our respected moderator of today, Sureshji, fellow panelists, distinguished guests, and dear friends. I'll be sharing the impact of COVID-19, especially on women and minority. It's a known fact that women and men have been affected differently by the threat of and the spread of COVID-19. Every disaster does that, right from tsunami onwards. If you follow the humanitarian aid chart, you see that happening. And especially COVID-19 now in the UN is called the shadow pandemic. Several studies have been conducted by reputed institutions like the UNFPA, National Commission for Women, WAREC, Asia Foundation, and the Nepal Police. The findings has helped us to undertake and understand how women and excluded groups have been affected differently by the threat and spread of COVID-19, how they are coping and what might be needed in the near future and in the long term to help them recover and be resilient. And as Dr. Rajesh called it, to build back better. As we see, we have heard in detail from Rameshji, our previous speaker, about the global economy is staggering and shrinking. And it is affecting women more adversely as they are in the informal sector. And sometimes they are counted like 70%, 80% and until 90% women are in the informal sector. So she's hit harder. And they are the last ones to be hired and the first ones to be fired. We all know that. And globally, we know that businesses have been shut down. 40% businesses have been shut down. The third part I want to talk about is the existing inequalities has widened dramatically after COVID-19. And this, my previous speakers have given lots of evidences. Dr. Rajesh already spoke on inequity, and the Vijayji talked about the digital divides. So I don't think I need to explain that because you already see the discrimination women faces from womb to tomb. And COVID-19 has really exacerbated this. We are also seeing the loss of jobs and livelihoods due to the lockdowns, and it has literally led to hunger and starvations. In reality, we see it. We have so many case studies on that. And the restricted mobility has led to food crisis and cut in their earnings. It has led to fear, threat, conflicts affecting their mental health and rising violence, and especially domestic violence is soaring in COVID times. And the most disturbing factor is the number of suicides, the way it is rising. In the first 4 months of the lockdown, 2,218 cases of suicide was reported. And what was more scary was there were pregnant women, who were killing themselves, who were committing suicides. And Vijayji also talked about Darchula. So I have a case study from Darchula too, where a mother with 2 children jumped off the cliff because they couldn't cope with the anxiety that COVID had built around them. In addition, women's household responsibilities rose sharply as the family members were all at home during the lockdown period. The children were at home, the husband was at home, and everybody being at home, the unpaid care and household work has tripled. Their work burden, unpaid work burden, as all are at home 24/7, resulting in diminishing production and earnings remain depressed. On the other hand, women do stand at the front line of the COVID-19 crisis as healthcare workers, caregivers, and community organizers combating the pandemic. But this part is always missed. Whatever is quoted. Whatever is quoted is the vulnerable part of women is quoted. There's some disturbance somewhere. So that is very, the oranges and the apples are kept in the same basket. And that is very disturbing. And despite women making up a majority of frontline workers, there is misappropriate and inadequate representation of women and excluded groups in national COVID-19 policy spaces. And we heard about the policies right from the beginning. It's very gender neutral. Nobody refers, whether we are talking about the capable women or the vulnerable women. Yet their resilience is noteworthy. They are lumped with only the vulnerable group as recipients, but they should also be part of the caregivers category. And whenever there is mention of women, the intersectionality is always missed out. Which women is, always missed out. You lump women as one, you generalize it. The crisis has highlighted both the centrality of the contribution too. So we also have to look at that factor, and that has to come out, whichever sector, either we are talking about agriculture, we are talking about health. We have to remember that 51% of the people we're talking about are women, and that is generally forgotten. It's not mainstreamed. It's not taken seriously, when it's planned. And the massive awareness campaign, for recommendation, I would say that what needs to be done, where there is disparity, where there is inequity, where the inequalities are rising and women are suffering. And, when this scenario is there, what would be, I have just put in, here you see 2, but I have added 1 more. Massive awareness campaign is very necessary. And as Dr. Pandey mentioned, the precaution part and the vaccination parts, there are so many myths around, around the vaccination also. So I think it's very important that, this has to be, the right to information has to be taken very seriously, and there should be massive awareness campaigns at all levels. And here I really think FIPMO can play a very vital role in it, Therefore, mapping human vulnerabilities with sex and age disaggregated data. And also we have to map capabilities. This is very vital. And if we have this, then I think the actual picture of people's access, people's vulnerabilities, people's capacities will come out. And the last point I want to mention is, I want to stick to my 10 minutes. The last point I want to mention is the gender empowerment and social inclusion consideration in the pandemic has to be to all sectors. And it is very essential if we are serious about mainstreaming gender in the recovery process. So I'd end my presentation here. And if there are any questions, I'll be very happy to answer. Thank you.
Thank you very much, Chandni. I can see that you are quite used to making presentation on the right in the given time. I don't see any comment right now, so we will take up questions after the last presenter, Dr. Surendra Pandey, on logistics and operations management. Surendraji, the mic is yours.
Thank you. Good afternoon to everybody. Sometimes it is very difficult to be the last speaker in any forum. But I think at the same time, I always think that it's very lucky that you have to speak less, because a lot of things would have already been spoken. So my thanks to all the previous presenter speakers that have already laid the ground, actually. And I see usually in different levels when we talk about the logistic and operational management, the problems are there. Of course, taking in perspective the time given for the presentation, I would not be able to go into detail of the problems and try to make sure that some of the things which have already been spoken by other presenters, I'm not going to touch that one. But beside that one, when I will come to my recommendations, so I might be touching those areas as well. In my opinion, so the family level issues are there, because we talk about the accessibility to the goods, be it daily consumers items or whatever it is, then medical supplies, masks and sanitizers. Then we can talk about the small equipments like the COVID measurement kits like oximeter, thermometer, and that kind of the things. Sometimes we do have the sick people actually who are infected by COVID sitting home, and we don't have the access to them. And nobody cares how they are doing when they are on their home, the isolations. So it is one of the area which we should be thinking very seriously, in my opinion, because these people needs a little bit of they feel little good when they were touched by, they will come in contact by outsiders, their community people, some volunteers and the things. So that will make their life much easier than to be in a very, very difficult situation there. Then of course, when we talk about the community level and the things, I think messaging is a problem actually. We really talk about, awareness should be created, a lot of messages should go, but we can see at the same time the uniformity is not there. And most of the time, very negative message goes to the people. And we have to be very pragmatic with this respect, because there are so many things that have already been done, and positively, we should give that messaging as well, because otherwise people get so scary. And I can still remember just two months ago, I mean, the situation was difficult, really difficult, even for the people like me. And the lack of tracking system is there, basically. It completely misses, especially the home home-based isolated patients and the things. We have not been able to get to all of them. and lack of communications and counseling. I think when we talk about the social counseling and the things, it is very important. And from my work as well, from UNHCR, I learned a lot about it, but in our COVID situation in Nepal, these things are missing. We do have institutional policy, but when it goes down for the implementations, we have a big problem there. Because, for example, I'll just try to cite one example. There was a meeting of CCMC recently in April, Baisak 17th or something like that, and there was a lot of discussions they have made, and they come with the measures what has to be taken in order to make sure that the COVID issues are taken care of. But in the measures to be taken, they are just giving the instruction to different organizations at different levels. You have to do that, 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 you have to do that. What next after that is absolutely not spelled out there, unfortunately. So I think this kind of the instructions and the things must have gone a lot. At the same time, we could see that the so-called, the policy on COVID is really good, well written and the things. But what is the use of the policy when the interventions are not really good to make sure that the issues raised, the recommendation made in the policy to solve those issues are not as addressed by the real, the activities and the thing. So this is another things which is missing absolutely. And government's accuracy in information disseminations is a problem, because but now it has been improved a lot. I think it's taken by the Ministry of Information. Now it goes from one focal point and the things, but there are still messages you get in the TV, radios and the things. It is coming up, but that contradicts one with another. So we have to be very careful in really giving the messages. It's not just in the name of creating awareness. We may be giving a wrong message to the people. That's why there has to be one focal point for this one. For all the message that goes at the national level, as well as trickle down to the province and the community. A lockdown, of course, not systematic in many instances. We have seen that, we have experienced that. And when we talk about really the vaccinations and the procurement, of course, we have witnessed that there was a delay in procurement, and the supply was not in accordance with the requirement and the thing. Storage problems are still there, and the management of the vaccinations for the crowds and other things are pretty weak. It's even a simple things we have not been able to manage. Despite saying this, that there are problems that exist, I think we cannot say that the government, the people engaged in this very pandemic are not doing a lot, be it security forces, be it medical officers and the things, be it community workers. They have been trying to do it, but not in a planned way, in my opinion. So I think when we talk about the issues here, and try to address that, of course, the holding centers, isolation centers are very important. Previous speakers, Dr. Pandey, have already said, highlighted on that one. So I better go directly to the recommendations now. What should be like? Some of the recommendations that I have made, it is not really research-oriented things, basically. It is little reading, little bit of experiencing, little bit of witnessing. That's what it is, and a lot based upon my one experience working in the refugee situations. So I think my recommendations, what I'm going to make out here, is on the basis of that, if the government would be needing some kind of the support from FIPMO experts will be ready to provide that on a pro bono basis. Recommendation number 1, family level supports and mechanism for day-to-day supplies and the things has to be put in place actually. And perhaps this could be done based upon the neighborhood and community volunteer supports. Actually in a very extremely large refugee situations and the things, and also in the the natural disaster things like in the earthquake in Pakistan and other places. I have worked in the operations, and I still believe that it is simple things and we can put in place by making sure that we do have the committed and the trained volunteers and the neighborhood support. So this is recommended for government definitely to do it, and we could be useful for that at the same time. Actually, a big gap exists, in the uniformity of the messaging that I told earlier. So this would be needed to make sure that these issues are addressed by the government in the right way, so that messages goes and the right messages goes from one one door policy or something like that, which the Ministry of Information has taken right at the moment in coordination with others, of course, the relevant actors. And now on the basis of the logistical things, it's very important to make sure that the holding centers and other are put in place. I think this is one of the very important issues that we should not be closing our eyes without doing it. Like in the border areas, from east to the west, there are a number of such areas where we do have a porous borders, and we have to put everything into perspective, and we have to put everything right there. And as I understand that the CCCM was in the beginning recommended by the Nepal Army, had suggested that 30 such strategical points which they have identified. There we have to create the holding centers. But until today, nothing is done. But with the own initiative of Nepal Army, I think in 10 areas is being done. That's what I understand. But my recommendation still would be that this has to be done in all 30 areas that would be used for the strategic purposes in the future as well.
Surenji, can you wrap up in 1 minute, please?
Okay, I'll do that. Okay, another one is the hospital things, the COVID, COVID-specific hospitals. So at least in every single province, there has to be one, despite of the fact that 33 hospitals were recommended during the very onset of the problem. Only few of them are there. This has to be looked into properly. My last recommendations would be that it is about the vaccinations, and vaccinations has to be also given to the private sectors. Still, there is a need for that one, and whoever can pay for it, they will go and take the services. For example, in India, Delhi, wherever you go, in the small clinics, even in a good pharmacies and the things, 780 rupees you pay, and they get the COVID shot given. So why can't we do the same thing, provided that the control mechanism and the reporting mechanisms are put in place? And at the end, issues of the children are coming up. We are talking about the vaccination for the children. If that is going to be haphazardly managed, like in the case of the elders before, where the crowd was not managed, where people were getting the vaccinations by talking to their own people, favoritism was there, and it should be avoided completely. When the vaccination comes for the children, it has to be specifically school by school. You may be, identifying the area, how many schools are there, but that has to be school by school, and there should be no compromise and the tolerance that anybody out of the school will get the vaccination. That's what I have to say for now. Thank you very much.
Thank you very much, Surenji. Thank you, all the speakers. Now, it is already 4:30, but I hope we can take about 15 minutes to have some conversation. So please raise your hand, and one of the co-hosts, my colleague, will help me identify. In the meantime, I have a couple of questions in the chat box. So I will start with, you may have already seen Dr. Badri, since it relates to the, you were the first presenter. There was a question whether the vaccine being applied in Nepal is accepted internationally. Would that allow Nepalese to travel, or is there likely to be some problem?
I think so. I think it is acceptable, because I could give you an example. There was some question about Bheosel, whether it will be acceptable. But my grandchild, he had to go to States, and he got a letter from the university that, well, he can have Bheosel vaccine and there is no problem on that. So Bheosel is the only vaccine where people had some doubt. Otherwise, others are AstraZeneca, this Covishield, that is AstraZeneca vaccine, that is acceptable everywhere. And I think only these are the two vaccines now, and Johnson Johnson, of course, it also is acceptable. So I think there is no problem in that at all.
Thank you. There was one question to Rameshji on chat box about what is the status of the food production in the light of pandemic and shortage of seeds, fertilizer, and so forth. What happened to food production and the impact on food security? Rameshji, would like to address that?
Total agriculture ko GDP growth चाहिँ नि estimate गरेको छ हाई हैन
Please, can you please mute your speaker, please? Microphone.
त्यसको डिटेल डेटाहरु चाहिँ नि मैले पनि हेरेको छैन पुरुजीहरुले हेर्नु भएको छ कि त्यो चाहिँ नि उसमा छैन सीबीएस ले पनि त्यो ब्रेकडाउन दिदैन र कृषि मन्त्रालयमा पनि त्यो अहिलेको लेटेस्ट ब्रेकडाउन छैन तर के छ भने फिशरी र धानलाई चाहिँ नि जहिले पनि सिंगल आउट गर्छन् फिशरी र धान राम्रो हो भने ओभरअल जीडीपी राम्रो भएको कारण के भन्छन् त्यो त सफिसिएन्ट एक्सप्लेनेसन भएन त्यो क्याश क्रप्स अरु लाइफ स्टकहरु छ तर जुन किसिमको एग्रिकल्चरको ग्रोथ कन्टिन्युअसली लास्ट 4-5 वर्षमा 2-3% ले भइराखेको छ त्यो हेर्दाखेरि चाहिँ नि अलिकति कमर्शियल ज्यादै कमर्शियल एग्रिकल्चर जहाँ इनपुट्सहरु डिपेन्डेन्ट हुने खालको सेक्टरमा अलिकति डिस्ट्रप्सन भएको छ हैन भने एग्रिकल्चर चाहिँ नि जुन ठाउँमा पनि रेजिलिएन्ट अहिले कोभिड-19 को बेलामा अरु देशहरुमा पनि अरु पार्ट अफ इकोनोमीहरु श्रिंक हुँदाखेरि पनि एग्रिकल्चर चाहिँ नि हैज बीन रेजिलिएन्ट र यहाँ पनि त्यही किसिमको देखिन्छ यहाँ पनि र जीडीपी को त्यो जुन डेटाबाट पनि त्यही देखिन्छ तर अब एग्रिकल्चरमा पनि अब कमर्सियल एग्रिकल्चरले अलिकति सफर गर्यो होला, नन कमर्सियल चाहिँ नि जुन इनपुट्सहरुमा डिपेन्डेन्ट धेरै नहुनेहरू चाहिँ नि बेटर हुनुपर्छ। एसियन फाइनेन्शियल क्राइसिसमा एसियामा 1996 मा पनि किसिमको एग्रिकल्चरले सबै एब्जर्ब गरे अवस्था थियो, त्यो बेला पनि अरूतिर भद्रगोल हुँदाखेरि पनि त्यो सेन्समा चाहिँ नि अब भनौँ न हामीहरु कहाँ पनि एग्रिकल्चरले चाहिँ नि नै किसिमले एब्जर्ब गरिरहेको छ, एक्स्ट्रा मान्छे गाउँमा सहरबाट गाउँमा जाने उ गर्ने। र अब फुड प्राइसको एंगलबाट पनि अहिले भर्खर प्रेसर बढ्यो, नत्र भने त्यस्तो किसिमको धेरै प्रेसर चाहिँ नि भएको छैन इन्फ्लेसनमा। कारण छ त्यो ओपन पोरस बोर्डरले गर्दाखेरि हो। तर अब त्यसको डिटेल चाहिँ नि डेटा चाहिँ नि निकालिसकेका छैन र हेरेको छैन। पुरुजीहरूलाई केही छ कि त्यसमा हेर्नु भएको छ कि? हिजो मात्रै उहाँले त्यत्रो इन्टरभ्यु दिनुभएको छ।
पुरुजी केही भन्न चाहनुहुन्छ? पुरुजी
विनोद
फोटो छैन। विनोदजी केही भन्न चाहनुहुन्छ?
खास केही छैन, रमेशले जे भने त्यही नै ठिक हो जस्तो लाग्छ। डेटा नै छैन अहिलेको अवस्थामा कसरी बोल्ने
हो। म पनि उहाँले रमेशजीले भन्नुभएको कुरा सेयर गर्छु। यो एग्रिकल्चर सेक्टर चाहिँ हाम्रो धेरै इन्फर्मल सेक्टर चाहिँ जुन छ मार्केट भनौँ न धेरै चाहिँ इनपुटहरू नगर्ने तिनीहरूलाई चाहिँ खास असर परेको देखिन र मार्केट डिपेन्डेन्ट पनि भनौँ न बेच्नको लागि पनि कमर्सियल एग्रिकल्चरलाई चाहिँ अलिकति एफेक्ट गरेको देखियो। लकडाउनहरूले यिनीहरूले मुभमेन्ट हुन पाएन बा त्यो मार्केटको एक्सेस चाहिँ लिमिटेड भयो भन्ने। तर अहिले अलिकति यो बाहिरको लेबर फ्लोहरू पनि भएको हुनाले अलिकति लेबर सर्टेजलाई पनि यो यिनीहरूले चाहिँ यो कोभिडले चाहिँ अलिकति बाहिर मान्छे जान पनि पाएन नि। त्यो एग्रिकल्चर सेक्टरमा जुन अलिकति लेबर सर्टेजको इस्यु थियो त्यसलाई पनि राम्रै गरे जस्तो लाग्छ र वेदर पनि अलिकति राम्रै भयो जस्तो लाग्छ यो लास्ट 2 इयर्स। त्यो फ्याक्टरहरूले पनि त्यति नराम्रो चाहिँ एग्रिकल्चर सेक्टरमा चाहिँ सिरियस इस्यु देखिएन। त्यसले गर्दाखेरि प्रोडक्सनलाई त्यति एफेक्ट गरेन होला जस्तो लाग्छ। दिस इज आवर putting 2 and 2 together, yes.
हस्, धन्यवाद रमेशजी, पुरुजी, विनोदजी। हामी डाक्टर जनरल बालानन्द शर्मा जोइन गर्नुहुन्छ भन्ने आशा गरेका थियौँ, तर जुन मैले अघि भने 2 बजे उहाँको राष्ट्रपति कहाँ मिटिङ थियो, सायद अब सकिएन होला। हामी अब केही प्रश्न छ भनेदेखि केही क्वेसन कमेन्ट छ भनेदेखि त्यो सुन्छौँ र उहाँहरूको 2-4 मिनटमा आइपुग्नु भएन भने हामीले मिस गर्ने भयो उहाँलाई। केही क्वेसन कमेन्ट कसैको छ? हजुर सुरेन्द्रजी, अघि तपाईलाई टाइम छुट्याएको थिएँ मैले। यो टर्म
इफ आई एम अलाउड है, मेरो अघि प्रेजेन्टेसनमा टाइम चाहिँ छिटो छिटो दौड्नु पर्यो। इफ यु विल अलाउड मी, म दुईटा जति चाहिँ नि पोइन्ट्सहरू राख्न चाहन्छु। एउटा चाहिँ नि द बोर्डर एरियामा चाहिँ नि 30 वटा जुन चाहिँ नि स्ट्राटेजिक पोइन्ट्सहरू आइडेन्टिफाइड गरेको थियो र त्यो रिकमेन्ड गरेको थियो आर्मीले सिसिएमसी को लागि, त्यो भएन। अब 10 वटा चाहिँ नि बन्दैछ अरे भन्ने सुनेको हो। अनि अरू बाँकी पनि बन्नुपर्छ, किनभनेदेखि हाम्रो बोर्डर इन्डियासँग त भेरी पोरस बोर्डर हो, जहिले पनि ओपन छ। कुनै पनि बेला चाहिँ नि सिचुएसनमा हामीले हाम्रो चाहिँ नि जुन भएका चाहिँ इन्फ्रास्ट्रक्चरहरू छन् त्यसलाई युज गर्न सक्छौँ। र स्ट्राटेजिकली हेर्ने हो भनेदेखि यो 30 वटा चाहिँ नि यो आइसोलेसन र चाहिँ नि यो होल्डिङ पोइन्ट्सहरू बनायो भनेदेखि जुन सेन्सिटिभ एरिया, सिरियसली सेन्सिटिभ एरिया छ त्यो चाहिँ नि आर्मीले म्यानेज गर्न सक्छ। त्योभन्दा लेस सेन्सिटिभ एरियाजहरू चाहिँ नि जस्तो यो चाहिँ नि आर्म पुलिस फोर्सले गर्न सक्यो र अलिकति एडमिनिस्ट्रेटिभ र फ्यु चाहिँ नि इफोर्ट्सले मात्र हुने एरियाजहरू चाहिँ नि पुलिसले चाहिँ नि गर्न सक्छ होला। तर सरकार सुड मेक स्योर द्याट हाम्रो इनिसियल क्यापिटल यसमा लागेपछि यसलाई लङ्गर टर्ममा प्रलङ गरेर युज गर्ने योजना पनि मेरो विचारमा डेफिनेटली पनि त्यो स्ट्राटेजिक योजना चाहिँ थियो होला। आर्मीसँग डिस्कसन गरेर we have to put this into place now. I think it's very important. मेरो एउटा त्यो चाहिँ किन यो आजको मात्र इस्यु हैन, भोलि पर्सि नि पर्सि जहिले पनि हुन सक्छ। अनि त्यसको लागि त्यो चीज हामीले फाइन ट्युन गरेर राम्रो स्थितिमा राम्रोसँग अरू युज गरेर राख्यौँ भनेदेखि कुनै पनि बेला कुनै पनि यस्तो चाहिँ नि पेन्डेमिक्सहरू यिनीहरूको लागि इमर्जेन्सीको लागि युज गर्न सकिन्छ। र अर्को चाहिँ नि चिज जुन कोभिडको पोलिसिज इज गुड, इन्टरभेन्सन्स आर ब्याड भन्ने कुरो गरेको थिएँ मैले। त्यसमा चाहिँ नि द गभर्मेन्ट सुड नट बी साई, एक्चुअली सुड नट बी साई टु मेक स्योर द्याट स्ट्राटेजीलाई एकचोटि रिभिजिट र रिभाइज गर्न जरुरी छ, जसले गर्दाखेरि हुनै नसक्ने चिज चाहिँ राखेर के गर्ने, क्षमतामा भएको जे छ त्यो जति मात्र चिजहरू राख्यौँ भनेदेखि त्यो चाहिँ इन्टरभेन्ससँग साथसाथमा जाओस्। मेरो चाहिँ त्यति नै भनाइ हो थप्न पर्नेमा। थ्याङ्क यू भेरी मच।
थ्याङ्क यू सुरेनजी। अरू कसैको केही? डाक्टर बद्री?
एउटा सानो इन्फर्मेसन सेयर गरौँ जस्तो लाग्यो। मैले हिजो अस्ति मात्रै पढेको हुनाले यो के भने यो जुन यो कोभिड अहिलेको कोभिडको चाहिँ नि यो नयाँ म्युटेन्ट आएको छ डेल्टा, अब त्यसमा चाहिँ त्यसबाट जो कोभिडको चाहिँ इन्फेक्सन हुन्छ त्यसको सिम्पटम्सहरू पहिलेको भन्दा अलिकति भिन्न किसिमको उसबाट हुन्छ। त्यसमा खास गरेर देखिया छ कि यो चाहिँ नि बेसरी चाहिँ नाकबाट पानी बग्ने, अनि टाउको दुख्ने, अनि यो टाउको दुख्ने प्लस चाहिँ नि स्निजिङ, सोर थ्रोट र कहिले कहिले लस अफ स्मेल। यो these 5 symptoms have been found to be going now, is particularly in UK and other countries. यो नयाँ डेल्टा भेरिएन्टको त्यसैले त्यो हामी भ्याक्सिन लिए तापनि we also may be getting COVID-19 infection, so we should take care of that. त्यस्तो के भयो भने PCR टेस्ट यताउता चाहिँ गरिकन आइसोलेसनमा बस्नु चाहिँ नि युजफुल हुन्छ होला। जस्ट बाइ द वे।
थ्याङ्क यू हजुर, थ्याङ्क यू।
थ्याङ्क यू। अरू कोही? भीमजी?
हजुर सुरेशजी, हजुर, thank you very much सुरेशजी. I think I was listening from the very beginning. साथै इन्ट्रेस्टिङ यो आजको प्रेजेन्टेसन भयो सबै एक्सपर्ट्सहरूबाट, इन्क्लुडिङ WHO रेप। आई विश यो अधिकांश खालि अब हामी 30 जना 32 जनाले मात्र नभएर धेरैभन्दा धेरै मान्छेले यो सुन्न सकेको भए, यति राम्रो जानकारीहरू इन्फर्मेसनहरू आयो, रिकमेन्डेसनहरू आयो, यसलाई अलिकति हामीले कसरी चाहिँ अब नेसन वाइड टेलिभिजन भएको भए झनै राम्रो हुन्थ्यो होला। तर त्यो कमसेकम अब आज आएको डिस्कसनको आधारमा, प्रेजेन्टेसनको आधारमा उहाँले जुन गरेको रिकमेन्डेसन, इन्क्लुडिङ हाम्रो पेट्रोन हिमालय शमशेरजीले चाहिँ भन्नुभयो त्यो के अरे सफ्टवेयर डेभलप गर्नेदेखि लिएर इन्फर्मेसन सेयरिङ, यी सबै कुराहरू चाहिँ हाम्रो एउटा रिकमेन्डेसन जस्तो बनाएर अब जेनरल बालानन्द शर्मा आउनु भएन, तर उहाँको अफिसलाई या अरू कुनै रेलेभेन्ट जस्ट गभर्मेन्टको कुनै पिएमओलाई, प्राइम मिनिस्टर अफिसलाई नै भनौँ, तिनीहरूलाई चाहिँ अब फिप्मोको तर्फबाट हामीलाई लागेको कुराहरू कहाँ विकनेसेसहरू कहाँ छन्, लुपहोलहरू कहाँ छन् र हाम्रो तर्फबाट रिकमेन्डेसनहरू के हुनसक्छ। यो अहिले पनि समस्या छँदैछ। यो समस्या केही समय अरू हामी कोभिड-19सँग अरू केही समय अझै सँगसँगै बाँच्नुपर्ने हुन्छ, सँगसँगै हिँड्नुपर्ने हुन्छ र कसरी यसलाई इम्प्रुभ गर्न सकिन्छ भनेर त्यो एउटा बनाएर दिन पायो भने हुन्थ्यो, बेस हुन्थ्यो कि भन्ने लागेको, त्यो एउटा सजेसन हो।
धन्यवाद भीमजी। म त्यो भन्नेवाला थिएँ। हामी यो आफ्टर द कन्क्लुजन अफ दिस सेसन, first of all, we are going to put this recording on our website so that this conversation can be listened by others at all time. Then we'll also prepare a short report in Nepali as well as in English and send it to the parties concerned as you were suggesting. Thank you. Now I see that Vijay Rajbandari, Vijayji, तपाईं केही भन्न चाहनुहुन्छ? त्यसपछि पुरुजी।
Thank you, Sureshji. I just wanted to, I think I just have a small question to Dr. Badraj Pandey and also Dr. Pandav. Today, I saw in the newspaper that there has been some disaggregated data of the infections on the people and the number of doses they have received and when did they receive. I think that's a wonderful information. I think if that could come more regularly and more organized manner, I think that would be extremely helpful to the people. Thank you.
Thank you, Vijayji. Dr. Pandey, केही थाहा छ भने तर पाण्डव चाहिँ जानु पर्यो जस्तो लाग्यो एकैछिन त्यहाँ WHO को पुष्करजी हुनुहुन्थ्यो उहाँले केही थाहा छ भने थप्न सक्नुहुन्छ डाक्टर पाण्डे पहिला तपाईं केही भन्नु न
त्यो खै मेरो उसमा आशय नोटिसमा आशय न त्यो डिसएग्रिगेटेड डेटा हो त इट इज अफ कोर्स इट विल बी भेरी भेरी युजफुल अहिले प्रब्लम के छ भने मुख्य चाहिँ नि यो 68% चाहिँ एन्टिबडीज देखिनु इट इज ए भेरी हाईली हाई म्याटर अफ हाई कन्सर्न क्या अब त्यो उसलाई अब त्यसमा के भनिया छ भने ओन्ली 5% जो चाहिँ नि यो जसले चाहिँ नि जो इन्फेक्टेड उस मात्रै त्यसमा भेटिया छ 5% भनेपछि त बाँकी कस्तो भयो भने हामीलाई इन्फेक्सन थाहै छैन कम्युनिटीमा कति भइरहेको छ तर एन्टिबडीज देखियो भन्नुको मतलब दे मस्ट बी ह्याभिङ इन्फेक्सन सम टाइम समवेयर व्हिच यु डोन्ट नो एन्ड द्याट इज अ भेरी रिस्की थिङ त्यसैले यो फर्दर इन्भेस्टिगेसन्स विल बी नेसेसरी
थ्यांक यू डाक्टर बद्री
point clear I don't know did I make my point clear
Yeah, I think that's fine. Thanks.
Okay, विजयजी डाक्टर पाण्डव पनि अलि जानु परेछ अनि पुष्करजी हुनुहुन्थ्यो उहाँ पनि निस्कनु भएको रहेछ अब विल पर्स्यु थ्रु अनदर मिन्स
थ्यांक यू
पुरुजी केही भन्न चाहनुहुन्छ
हजुर मेरो पनि डाक्टर बद्री पाण्डेलाई चाहिँ मेरो क्वेशन चाहिँ अलिकति यो अब यो अहिले स्कुलहरु पनि रिओपन भइरहेछ अब गभर्नमेन्टले त एलाउ गरिसक्यो हैन अनि यो डेल्टा भेरिएन्ट चाहिँ चिल्ड्रेनहरुमा बढी आउने भनेको छ भनेपछि त अब चिल्ड्रेनहरु स्कुल गएपछि अब भनेर अब यहाँ स्वास्थ्य मापदण्ड पालन गर्ने भनेको छ तर हामीलाई थाहा छ अब नेपालमा त्यो कतिको पालन हुन्छ भनेर त्यो पनि विशेष गरी चिल्ड्रेनहरुसँग दे आर भेरी एक्टिभ पिपल हैन अनि त्यसले गर्दाखेरि त अब ठुलो रिस्क चाहिँ त देखिन्छ नि अब त्यसबाट चाहिँ प्यारेन्ट्सहरुलाई ट्रान्समिट हुने भन्ने चाहिँ र उनीहरुलाई पनि अब चिल्ड्रेनहरु पनि एफेक्टेड हुने र त्यसबाट चाहिँ उतातिर जाने चाहिँ एउटा रिस्क देखिया छ त्यसको लागि गभर्नमेन्टले के सोचेको छ कुनै हामीले केही चाहिँ भन्न पर्छ कि उनीहरुलाई है एउटा कुरा चाहिँ अनि अर्को कुरा चाहिँ यो जुन अर्को के भन्छ नि यो अहिले भ्याक्सिन लिइसकेलाई चाहिँ पनि भएको चाहिँ युएस मा देखिरहेको छ अब सीएनएन मा धेरै देखिन्छ त्यो त डिस्कसनहरु अब त्यो कुरा त हामी कहाँ यहाँ पनि आउला अब कतिको केस आएछ थाहा छैन तर आयो भने चाहिँ अब हामी कहाँ त त्यो त्यस्तोको त अहिलेसम्म सोचेको छ कि छैन हैन अब भ्याक्सिन त्यसको लागि ल्याउनु पर्छ कि पर्दैन अथवा हाम्रो प्रायोरिटी चाहिँ पहिले भ्याक्सिन 2 डोज नै लगाउने चाहिँ पहिलो प्रायोरिटी हो कि है अनि त्यसपछि देन वी क्यान यु नो दिस क्यान बी काइन्ड अफ वेट काइन्ड अफ इस्यु हो कि के हो यो जस्ट माई क्युरियोसिटी थ्यांक
यो म यसको रेस्पोन्स अब यो स्कुलको उसमा चाहिँ डेफिनेटली यो चाहिँ इट्स अ म्याटर अफ ग्रेट कन्सर्न यस्तो छ तर व्हाट आई अन्डरस्ट्यान्ड कि गभर्नमेन्टले चाहिँ नि यो फाइजर भ्याक्सिन छिटै नै आउँदैछ दे हेभ अलरेडी पर्चेज्ड इट एन्ड इट्स कमिङ र त्यसको लागि त्यो स्टोर गर्नलाई पहिले प्रब्लम थियो यो रेफ्रिजरेटरहरू चाहिँ नि यो -80 डिग्री सेन्टिग्रेडसम्मको त्यो क्यापेसिटीको रेफ्रिजरेटर चाहिएको थियो त्यो थ्याङ्क गड अब 3-4 दिन अगाडि मात्रै 4वटा चाहिँ नि फ्रिजहरू चाहिँ नि कति 1.5 लाख डोज त्यो स्टोर गर्ने क्यापेसिटी भएको फ्रिजहरू आइपुगेका छन् इट हेज बिन ह्यान्डेड ओभर टु गभर्नमेन्ट अलरेडी अब त्यसैले चाहिँ नि अब भ्याक्सिन आएपछि मैले बुझेसम्म चाहिँ नि त्यो फाइजर भ्याक्सिन यो चिल्ड्रेनहरूलाई त्यो भ्याक्सिन स्कुल चिल्ड्रेनलाई त्यो दिने भन्ने चाहिँ नि गभर्नमेन्टको प्लान छ क्या अब तर अब स्कुल भनेपछि अब यतिका चिल्ड्रेन छन् कसरी चाहिँ नि manage होला त्यो चाहिँ नि it has to yet to be seen how they go on. अब त्यो सिलसिलामा चाहिँ अघि हाम्रो विजयजीले गर्नुभयो कि सजेस्ट गर्नुभयो कि या हाम्रो डाक्टर सुरेन्द्रले सजेस्ट गरे हो त्यो चाहिँ नि यो भ्याक्सिन दिँदा पनि स्कुल वाइज बेसिसमा दियो भने चाहिँ नि बेटर होला कि भनिकन त्यो पनि एउटा सजेसन हो त्यो पनि द्याट्स ए गुड सजेसन जस्तो मलाई लाग्छ which we should pass on to government. This is what we feel भनिकन अब नेक्स्ट चाहिँ नि यो भ्याक्सिन लगाएपछि कोभिड हुने त्यो त अघि मैले आई थिङ्क आई कुड नट एक्सप्लेन प्रपरली यो त छँदैछ यो त भ्याक्सिन लगाए पनि 10% लाई चाहिँ नि यो हुन्छ हुने चाहिँ नि देखिया छ तर खाली भ्याक्सिनेसनको फाइदा के भने सिरियस हुँदैन र चाहिँ नि हार्डली लेस देन 0.5% डेथ हेज बिन रिपोर्टेड सो फार अब त्यसैले त्यो कन्टेक्स्टमा चाहिँ नि अब हिजो मात्रै त्यो उसले अस्ति मात्रै यो हाम्रो मतलब युएस उसको एडभाइजर फौजी has recommended that third dose should be provided now. Pfizer को third dose should be provided to people. भनेको उनीहरु third dose मा आइसके किनभने यो यसको अब यो immunity maybe waning up gradually त्यो चाहिँ नि आवश्यक छ भनिकन उनीहरुले they have been working on that. एकातिर त्यो छ एकातिर मैले एउटा चाहिँ नि यो ब्रिटिश रिपोर्ट हिजो मात्रै पनि पढाएको थिएँ कि यो एस्ट्राजेनेका भ्याक्सिन कोभिशिल्ड जो हामीले लगाएको छौँ त्यसको चाहिँ नि इफेक्ट चाहिँ नि इट विल लास्ट फर अबाउट 1 year भन्छ र 1 year पछि मात्रै त्यसको उचाइएला भन्ने त्यो पनि छ त्यो यस्तो छ कि यो इन्फर्मेसन पनि इट इज देयर आर कन्फ्लिक्टिङ इन्फर्मेसन दोज डेभलप्ड कन्ट्रिज हु क्यान अफोर्ड जस्तो दे आर गोइङ फर इभन थर्ड डोज अहिले नै गइसके एकातिर अफ्रिकामा चाहिँ नि 1% पपुलेसन पनि भ्याक्सिनेटेड भएको छैन यतातिर उनीहरू चाहिँ थर्ड डोजको उसमा गइसके जस्तो फर इक्जाम्पल इजरायल हेज अलरेडी स्टार्टेड अब तर के भने अहिले उनीहरू के भन्छ थर्ड डोज स्टार्ट गर्ने बुस्टर त्यो चाहिँ नि टु एल्डरली र चाहिँ नि जो यो इम्युनो कम्प्रोमाइज उसलाई चाहिँ नि भनेको त्यो कोमोर्बिडिटिज भएका त्यस्तो केसेसहरूलाई चाहिँ नि it should be started भनेको त्यो उसमा लागिसकेको छ त्यसैले हामीलाई पनि we don't know हामीलाई पनि maybe we may need third dose also but the thing is still पहिले फर्स्ट डोजै पाए पनि पाउने यति बाँकी यति छन् they should get the priority as well.
Thank you very much, Dr. Badri. Gyanjang Sabaji.
Dr. Badri, I have a small question, Dr. Saban. You said
Sure.
that 68% has been found with antibodies. So with the rise of, now with the percentage of antibodies in the population and with the rising number of vaccinations, do you think we will achieve herd immunity in the near future?
अब यो कस्तो छ भने यो म्युटेसन जस्तो किसिमबाट म्युटेसन भइरहेको छ इट इज भेरी यो अनप्रेडिक्टेबल उसबाट भइरहेछ एन्ड त्यो अब यो भनिन्छ कि त्यो एन्टिबडिजको लागि चाहिँ नि एन्टिबडिज भए पनि त्यो एन्टिबडिज भएकालाई पनि भ्याक्सिनेसन हामीले सबलाई दिन सक्यौँ भने चाहिँ नि अफकोर्स देयर इज चान्स तर चाहिँ नि एन्टिबडिज भयो भन्दैमा कसैलाई इन्फेक्सन भइसकेको छ एन्टिबडिज भयो भन्दैमा भ्याक्सिन नलिने भन्ने चाहिँ आउँदैन एक्चुअली भ्याक्सिन लियो भने उसको इम्युनिटी झन् स्ट्रङ हुन्छ अथवा एन्टिबडिज पनि असम्मको चिज छ जस्तो मेरो आफ्नै इक्जाम्पल दिन्छु म मेरो उसमा एन्टिबडिज नै डिटेक्ट भएन आई हेभ टेकन 2 भ्याक्सिन्स अब के भन्ने अब यहाँ त्यो टेस्ट गरेको थियो भने नो एन्टिबडिज डिटेक्टेड अब द्याट डजन्ट मिन कि अब देयर आर नट अदर फ्याक्टर्स अल्सो हेल्पिङ टु प्रोटेक्ट मी देयर मे बी यो टी सेल्स एम सेल्स भन्ने डिफरेन्ट चाहिँ नि छन् दे मे बी working effectively. So the stereotyped antibodies भन्ने चाहिँ नि उसमा ब्लडमा देखिए अब only thing I should be careful a bit तर चाहिँ नि I think I feel good is okay. त्यसैले एन्टिबडिज पनि भ्याक्सिन लगाएको सबैलाई पनि हुनुपर्छ भन्ने चाहिँ नि पनि छैन सो मैले आफ्नै इक्जाम्पल दिएँ तर चाहिँ नि 95% मा चाहिँ नि एन्टिबडिज चाहिँ नि देखिन्छ in good amount.
Thank you, Dr. Badri.
Sorry, no. Herd immunity, this thing is used quite widely. Can you just reflect on what is
herd immunity
situation आउन सक्छ कि सक्दैन भनेर?
हैन, herd immunity चाहिँ नि त्यो इन्फेक्सन एकदम चाहिँ नि इन्फेक्सनबाट पनि एन्टिबडी जो फर्म भइकन इम्युनिटी एउटा त्यो हो, एउटा चाहिँ नि भ्याक्सिनेसन दिकन मास भ्याक्सिनेसन दिकन इम्युनिटी क्रिएट गर्ने हो। अहिले चाहिँ नि यो साइन्टिफिक एभिडेन्स के छ भने यो नेचुरल इन्फेक्सन भन्दा पनि यो जुन भ्याक्सिनेसनबाट जो यदि 95% of the people get vaccination or vaccinated, the whole population is covered. They all get community. And the herd immunity 95% 5% bonus points. So the whole community is get immunity. The whole community gets immunity.
Thank you, Dr. Badri. 5 पनि बज्न लाग्यो, त्यसकारण अब यो हामी कम्प्लिट गर्यौं। सबै साथीहरु आफ्नै विद्वान हुनुहुन्छ, उहाँहरूले भने कुरोलाई समराइज गरिरहनु त मैले सक्ने कुरो होइन, तर त्यो सबै
त्यहाँ पुरोजीले हात उठाइराख्नु भएको छ है।
त्यो उहाँको पुरानै हात हो जस्तो लाग्यो हैन पुरोजी?
मेरो पुरानै हात हो, म त्यसलाई झार्दिन्छु अब हेरौँ।
नझार्नुस् डाक्टर साहब, राखिरहनुस्।
Thank you. Thank you very much. सबै साथीहरु जसले शेयर गर्नुभयो आफ्नो एक्सपिरियन्स र एक्सपर्टिज, देशमा परेको यो महामारीको बेलामा आफ्नो क्षेत्रबाट हामीले कसरी सहयोग गर्छौं भनेर हामीले केही समस्याहरु देखायौं र त्यसमा हामीले के योगदान गर्न सक्छौं भन्ने पनि भन्यौं र यी क्षेत्रहरुमा हामीले डाइरेक्टली फिपमोका सदस्यको नाताले गर्न सक्ने कुरोलाई अब सम्बन्धित क्षेत्रबाट आह्वान भयो भने हामी तयार छौं भन्ने हाम्रो सन्देश सहित आजको वार्ताको यो कार्यक्रमको संक्षिप्त रूपमा तयार पारेर हामी शेयर गर्नेछौं। जस्तो मैले अघि नै भने हामी हाम्रो फिपमोको वेबसाइटमा पनि राख्छौं यो रेकर्डिङ र त्यसको समरी, अनि यहाँले आफूले र अरूलाई पनि शेयर गर्नु होला भन्ने आशा गर्छु। र त्यसको साथै अब आजको कार्यक्रम पनि यही अन्त गरौँ।
Thank you.
धन्यवाद सबैलाई, धन्यवाद।
नमस्कार।
सबैलाई धन्यवाद। नमस्ते।
नमस्ते तानी जी।
नमस्कार डाक्टर साहब, आराम है?
Nice to see you after a long time.
The same here, डाक्टर साहब।
अस्ति लन्डनको वेबिनारमा भेटेका थिएँ तपाईले, प्रिया बहिनीले गरेकोमा।
हजुर हजुर।
Now this is the second time I am seeing you, so happy. और सब ठीक छैन हजुरलाई?
सब ठीक छ डाक्टर साहब।
ठीक छ।